the statewide stay-at-home order, we are honoring our volunteers remotely. The Volunteer Sarasota County program has an excellent track record of engaging volunteers in various departments to improve the delivery of services to our community. It has benefited from having an extensive volunteer base of over 1,000 individuals, as well as hundreds of groups, including businesses, schools, and community partners that have generously donated their time, talent, ingenuity, and leadership to the Sarasota County Government Volunteer Program. The Volunteer Sarasota County program has provided the Sarasota County Commission with a big check in the amount of $7,212,104 for over 283,606 hours of service in fiscal year 19. This is an increase of 5,969 hours over fiscal year 2018. It is important to point out that the program has continued an upward trend with a 2.15% increase over last year. Once again, on behalf of the Sarasota County Board of County Commissioners and the Volunteer Sarasota County's team coordinators, we greatly thank these volunteers and all of the coordinators who have supported them for making such an important difference in our community and the communities that we serve. So again, a huge thank you. Obviously, we're not doing it justice here this morning with a quick read, but we wanted to do our best to recognize these folks. So thank you again to all involved. All right, we are on to the notes section of the agenda. Consistent with the guidance from the CDC and the executive orders of the governor of the state of Florida to limit public interactions, the public is strongly encouraged to submit comments on matters to be addressed by the Board of County Commissioners in advance of the commission meeting to be included in the official meeting record. In light of the extraordinary circumstances surrounding the COVID-19 health emergency, health screening procedures are in effect for visitors to Sarasota County facilities, including commission meeting attendees. Details are provided on page 8 of this agenda document. We are to open to the public, which is agenda item number 1. This is time reserved for persons desiring to comment before the board on items not scheduled for a public hearing. Persons wishing to speak at open to the public shall complete a request to speak card, including the number of agenda item, or if not an agenda item, the topic to be addressed. Comments on the scheduled agenda items will be heard first, followed by up to 5 speakers related to topics not on the advertised agenda. Any remaining speaker cards will be held for the final open to the public at the end of the meeting. Madam Clerk, I still don't have any request to speak cards. Seeing none, we're on to the consent section. Just real quick on that, we did get a number of electronic submissions for open to the public. All of that was dispersed to all the county commissioners electronically and otherwise. But that will be protocol going forward as far as I've been educated on. Our staff will deal with all of that communication that comes in from the internet and emails and such, and we'll provide it to all the commissioners. So we are to the consent section. All matters listed under the consent section are considered to be routine and will be enacted by one motion. There will be no separate discussion of these items. If discussion is desired by a commissioner, the items will be considered at the end of the consent section. I do have 2 items that need to be addressed. The first is the administration will address agenda item number 25 to be updated. Mr. Lewis.
Thank you, Chair, Commissioners. I provided the board and we have provided to the Clerk of Courts an updated resolution on item 25, and we would recommend approval of the updated resolution, not the original one. Happy to answer any questions, Chair.
Any questions for Mr. Lewis?
No.
Seeing none, agenda item number 31 need to be addressed by Madam Clerk, please.
Thank you, Mr. Chairman. Just briefly, there was a scrivener's error on the draft agenda, minutes that went onto the web. It dealt with an item to improve the minutes dated, it was actually on item 24 on that day, outstanding board assignments. There was a reference to the date of April 3rd, 2010. I don't know where we were, but it should be 2020. That's the scrivener's error. And we recommend you approve.
Thank you. With that, does the board wish to move agenda items number 2 through 31, addressing item number 25, correction outlined by the county administrator, as well as the Madam Clerk, the scrivener's error that she mentioned?
Mr. Chair, I would move approval of the consent agenda, including the administration update to item 25 and including item 31 to correct a scrivener's error.
Do I have a second? Second? I have a motion by Commissioner Dieter for the consent agenda items 2 through 31, and seconded by Commissioner Hines. All those in favor signify by saying aye. Any opposed? Chair votes aye. 2 through 21 passes unanimously. All right, we are to agenda item number 32, which is under the discussion section, and I believe we're going to start with County Administrator Mr. Lewis.
Thank you, Chair, Commissioners. Under this update today, very similar to what we did at the past two meetings. I have some brief comments I want to make, and then the Health Director is going to come forward and give a general public health update. Mr. Collins will come forward and talk about some of the status updates, both under emergency services and emergency management generally. And then Mr. Rob Lewis will provide an update on his function as our business and industry representative within the EOC. And then I would like some direction before I get into that, Chair. One of the items that I had planned on covering at the tail end of that is some of our reentry plans, specifically what it looks like with our beaches and open space activities, but a commissioner did put it on under their report. I'll do it either way. We can do it under the report, or what if the board prefers do it under this report, we could hit it now, whatever your preference is.
Commissioner Ziegler, you want him to do it now?
Yeah, it doesn't matter when we do it. Let's get it done.
Thank you, sir.
Go for it.
So while Mr. Henry's coming forward, and everybody that comes up to speak today, please allow Ms. Springer to do her job in between speakers. So while he's coming forward, I did want to kind of touch on a couple issues. We normally report on our building activities on a monthly basis, but I do have some updates as it relates to April and the first 2 weeks that I wanted to provide to the board as it relates to what's going on in our building function. Our total permits for March ended up being the highest for the fiscal year so far. The first 2 weeks of April, 682 and 742 permits just in the first 2 weeks respectively. So 683 and 742. For the year to date, fiscal year to date, just under 1,000 new home permits at 996 new home permits. And from a March to March perspective, so really that look at what happened for our first full month activity, it was up 14% for those new home permits over the prior year. And at the first 2 weeks of April, again, for single-family permits issued, single-family dwelling permits issued for April, 62 and 71 respectively for new home permits issued. And for inspections performed, and I talked last time about some of the innovative ways our building and planning and development services handling that, 2,500 in the first week of April, and just about 2,400 inspections performed in the second week of April. I think those are, some of the major things in our economy that we deal with from a local government perspective, and I think those are important things to take a look at. As I have each meeting, I can't recognize all of our hard work going on in the county, and I couldn't even begin to talk about the people who are working actively on the emergency every day. But beyond that, our communications team is doing a fantastic job, not just doing things like setting up for this meeting and what they do here, but how we communicate with our employees. They're critical in and making sure that gets done, as well as to the public. Our EIT, I told you at last meeting, they had created over 900 access points for our employees using devices remotely. Now that number's over 1,000. Commission services, they're not just taking care of your needs as it relates to these meetings and doing such a great job making sure the logistics are handled, but they're already working on how that looks for your planning and commission and how those meetings will pull out as we go forward. General services, they're still out there doing everything they normally do. Even at the EOC yesterday, they're there fixing a clog in one of the hot water pipes as it went into the bathrooms there. So huge role. I'd be remiss internally if we didn't also recognize, and I haven't mentioned it so far, but the work OCA is doing with us, Rick's office. Every day we have to touch them on something we're working on, and we appreciate. And then, of course, our firefighters, paramedics, and our lifeguards who are out there every single day doing their normal work. So I just wanted to again, I can't do everybody every meeting, but please keep all those folks in your thoughts as we go forward. Mr. Henry?
Thank you, Mr. Lewis, and Good morning, Commissioners. For the record, Chuck Henry, Director of Sarasota County Health and Human Services. I'm here this morning really to just provide you an update on key actions taken for COVID-19 since my last visit with you. Before I do that, though, I did want to take a moment just to thank my Health and Human Services team. They've been at this action for almost 60 days now, working long hours and most weekends. Many of them doing jobs they never even imagined they would have to do. So I just want to appreciate what they're doing. And that includes the County Human Services staff who are, again, doing many things, including helping out with our drive-through testing operations. I also want to thank Rich and his team at the EOC, Mr. Lewis, the county sheriff, and really the whole entire county team for the support they're providing to the health department and our health and human services efforts. We really couldn't achieve what we have without their support, so thank you. Now, in terms of updates, last time I was here, I talked about our drive-through at Twin Lakes. That operation has completed. We were able to accomplish just under 1,000 total tests with that operation. That included assistance from Sarasota Memorial Hospital, from the Sheriff's Office, from county staff, especially park staff. It was very successful. We had no big incidents out there on the drive-through process. And as big as that operation was, I just want to point out the back office operations at the health department supporting that were equally as large, because every individual that came through had to be screened to ensure they met CDC criteria. Appointments were made. The results were tracked from the laboratory. Calls were made to the individuals. Calls were made to their physicians. And of course, the recording in an electronic health record of each and every one of those tests had to be accomplished. So it is a tremendous amount of work. We're continuing with drive-throughs, and I'll speak about the pop-up drive-through concept here in a few minutes. I did want to mention the continuing efforts to do contact tracing, case identification and contact tracing. That's one of our most important public health activities, and in fact, the need for that activity will grow in the future, and I'll talk about that shortly. But we have a tremendous number of staff, both from our epidemiological team and our nursing staff, out doing this work on a daily basis, not only identifying each case, but identifying all those that have been in contact with that case during their infectious period, ensuring that those individuals are appropriately isolated or quarantined as appropriate. As I mentioned earlier, we have begun these, what I call small neighborhood pop-up testing operations. This operation is for the most part self-contained within our mobile health van or bus. It's really a big bus. We're able to go out on-site in neighborhoods and provide testing. Again, we're doing that by appointment, following CDC criteria. And we do get support from law enforcement at each one of these sites, although it's really not been necessary. The communities that we've been in have been tremendous. Everyone respects social distancing and the appointment operations. What really this has done is given us the capability not only to reach into neighborhoods that may not have had access to testing, but it allows us to provide testing to those that walk to the testing site or ride bicycles to the testing site, and so it's been a real positive for those communities. We had our second one yesterday in North Sarasota. We have one scheduled at Laurel Park on Thursday, and then down in Northport on Friday. We're already making plans to do some additional ones next week, and we'll continue that as the need dictates. We continue to work on concerns with homeless populations, along with multiple agencies and partners across the community. I want to assure the board that we've reviewed all of the CDC guidelines for homeless populations and have implemented all of those guidelines in Sarasota County. It doesn't mean there's not more work that could be done above and beyond those guidelines, and we continue to look at opportunities to do those things. We could
Kind of up for just 1 second.
Sure.
Commissioner Dieter has a comment.
Well, question before you move on, talking about the homeless, you've reviewed all the guidelines. What action have we taken?
So I'll try to do this from memory, because I covered most of those last time, but I can, we're working regularly with community partners. There's a weekly meeting that's led by the Suncoast Partnership to End Homelessness that we participate in. We've developed a sanitation and hygiene plan that outlines where those things.
What I'm looking for is not how many meetings we attended, how many phone calls we had, how many people we spoke to. What action have we taken that directly affects the homeless population in a good way?
So we have teams that have worked with those that are serving the homeless to ensure that they're practicing social distancing and helping us identify anyone that might be ill. We work with Sarasota Memorial, so if they have someone that's homeless and ill, before they release them, they contact our staff and we arrange, if necessary, for them to be housed during their quarantine or isolation period, depending on the situation. And we have implemented that plan and utilized it. We work with Salvation Army to ensure that they're following the best practices for infection control, looking at how they're doing feeding operations, talking to people in the community to make sure that people have access to the services they need.
Well, we're paying for beds at the Salvation Army. During this crisis period, are more people taking advantage of those or less?
I think they've been pretty steady, and they're maintaining their census maybe a little lower than normal based on our health recommendations because we had to spread out sleeping space to be safe and arrange a head-to-toe configuration. But I believe they're reasonably full every night. They've also tried to open amenities such as showers and feeding to those beyond the individuals just staying there to ensure those people in the community have access.
Are we passing out hand sanitizers? I mean, cleanliness is part of the cure, and with a homeless population, that's a problem. They don't have access to proper facilities for that, so how are we helping in that way?
So we try to monitor what's happening across our community, both in the county and in the cities. Parks have remained open. The facilities within parks have remained open to allow the same access that has always been there. As supplies have become available, we've tried to provide sanitizer to all of the service entities that meet with the homeless, whether they're feeding or clothing, to ensure that that's available. Sometimes, because it's what we have available, it's in gallon-sized jugs with pumps that they can utilize as they're approaching maybe a food distribution, because we just haven't been able to get the small ones that we can hand out. But whatever we have available, we try to make available in that way. Masks is another area that's coming online as more and more of those are available in the community. We're looking at ways to get masks out to our homeless community.
Chair, if I may add,
Mr.
Commissioner Dieter, one of the numbers that Mr. Henry had shared with me, this is probably a week or two old, but through that part of March at that point, the sheriff's office hot teams had been able to house, I think it was 32 people at that point, as part of that month of March in their normal, the homeless outreach teams through the sheriff's office. So that, it's not just the counties, it's the sheriff, it's the health department, and the community partners all working on their pieces.
And I thank you for reminding me of that. The City of Sarasota hot teams also have been working to try to house people through rapid housing. So there's been much discussion about how to address the vulnerable portions of that population, those over 65, those with underlying health conditions, and the funds that may be utilized to do that. We're still discussing what's the best opportunities there, but it looks like opportunities to prioritize that group for rapid housing is our best opportunity for those that are willing to move into that as we continue to assess the needs of that group. Okay, moving on, we worked and completed a countywide surge plan with leadership from all 4 of our hospitals, looking at key factors that we would be concerned about in terms of surge. It looks like at this point we've leveled off, or it may be even beginning to drop down a number of cases. I'm a real cautious person, so a week of slow drop doesn't make a big trend for me yet, but we're watching it closely and pleased with where that's at. We continue to focus staff resources on vulnerable populations in our elder care system. And the work done in this area started out early on with visits from our epidemiology staff and nursing staff to these facilities to ensure they had all of the current information from the Centers for Disease Control on how to properly do infection control and prevent illness. This progressed with joint visits with the Agency for Healthcare Administration, who regulates these facilities whenever a case occurs. So we go out jointly with them and conduct inspections that are really aimed at trying to help the facility. We have daily contact with all of our facilities. We have a staff at the Emergency Operations Center that calls all of our facilities every day to check on how they're doing. Do they have any illness in their facility that we're not aware of? Do they have adequate PPE? Sometimes we're able to supply that directly from the EOC. Other times we're not, but we put them on a priority list to get it to them as quickly as possible. We do follow-up calls and visits with any facility that has an illness identified, and of course, all facilities that have active cases. Those visits are made by my epidemiology team as well as nurses. We've taken advantage of resources made available through the state. One of those is infection control specialist teams that are coming out of the State Emergency Operations Center. We've had two of those one team that visited two of our facilities here, and those teams really provide focused, specialized coverage on infection control processes where we have outbreaks within a facility to ensure they're doing everything they can to help stop the outbreak and prevent more. We've also taken advantage of embedded resources from the federal level. We have a team from the VA in county right now at one of our facilities. These are teams of physicians, nurses, other health professionals that come in and work for several days at a time in a facility. And so they're able to see everything going on, not just what's there in a quick visit, but work side by side. And while they're in that process augmenting the staff, they're also doing on-the-job training in areas of infection control and personal protective equipment maintenance and wear. So those are really key assets that we've been able to take advantage of. And we have several of our facilities now on the list to take advantage of what's being offered through the state in the way of testing from the National Guard. I don't have a timeline on when they may be to our county yet because it's just evolved in the last few days, but National Guard resources have been made available to come into our elder care facilities and test all residents and staff in those facilities as they're willing to do that. Of course, we have to have agreement from each facility, and the majority of our facilities have agreed to get on that list and ask for that help as soon as it's available. I really can't stress enough the importance of this work in trying to limit the impact of this virus in our elder care facilities. We have a high percentage of our population who fall into that vulnerable population category simply because of age. In fact, in our community, I think all of us know that 37% of our population in Sarasota County is over the age of 65. And in some areas of our county, that percentage is even higher. I did want to pause for a minute and just acknowledge that much of what we hear about elder care facilities comes from our media, and it's often really sensationalized or negative things about what's going on out in our elder care facilities. I think it's important to acknowledge and recognize the work that the hundreds of men and women in our elder care facilities do every day for our community. They really are on the front line of providing care to our vulnerable population. As we're all too well aware, this virus is devastating to this population. So I really want to thank and appreciate those who face this virus really eye to eye every day in their work. They get up and go to work knowing they're going to be in contact with patients with this virus and care for the most vulnerable of the vulnerable in our community. And I think that work should be acknowledged and celebrated. And we will continue to support them in any way we can as we move through this public health emergency. Finally, I'll wrap up my comments with just a few items from a public health perspective that I think may be valuable to you as our county leaders. First, I think it's clear that transmission of the virus has decreased significantly because of the many social distancing actions taken by our governor, by you as our Board of County Commissioners, by our city leaders, and most importantly, by our citizens. This epidemiological curve, as we keep talking about, was flattened, and that's a really good thing. It's less clear, however, what lies ahead. We still have many vulnerable people in our community that we have to be concerned about and think about as we move forward. We are working on
Chuck,
the
can I
health.
interrupt you for 1 second? I have
Sure.
When he's done? Okay, keep going.
We are working diligently to increase testing in our community, but recognize that we need to do much more. to support a high level of continued rapid case identification and case containment as we move forward. And so we're every day out searching for opportunities to bring more testing into our community so that we can be ready as things move forward, because I think that's going to be a very important part of our process to move forward. And while it appears that there is an immune response to this virus, and there's hope that there may be some immunity, the science is still out on that, so we're watching that very closely, and there's no guarantee yet that just because you've had the virus, you're protected for any length of time. Great caution, slow, and selective are probably the key words that I would use when I think about how we move forward as a community and what unwinding whatever we've been in looks like. And so I'll just leave that there and end my comments. I appreciate the opportunity to work in this community and to continue serving our community. I'll take any questions you have. Thank you.
Commissioner Mayo, then Commissioner Ziegler.
Yeah, Chuck, 5.5 years ago, you gave me my first tour of facilities. Oddly enough, you're a state employee, but yet you gave me my first tour. And you're the tip of the spear in many instances in this whole situation for us. And for myself, and I'm sure for the board, it does not go unnoticed, all your efforts and all the times you've been put in tough spots making some of the decisions. So just thank you for that.
Commissioner Ziegler.
Couple things. Number one, where are we at in terms of PPE? And number two is, everyone's now starting to come out and say that there's going to be a second wave potentially. What are we going to do to plan for that? Let's say that happens in the winter, with flu season. What are we doing locally to get ourselves prepared for that? Are we going to stockpile supplies? Is that something that the commission needs to look at and helping in any way? What's your take on that?
So I can't say I've spent hours and hours thinking about 6 months from now because I'm focused
Yeah.
pretty much on the moment. But nonetheless, I do look at that and think about it. And first, I think in terms of PPE, we're starting to catch up to where we need to be. I don't think we're 100% where we need to be across our community right now. So it's hard for me to think about stockpiling until we meet all the needs. But every day we're getting more shipments in, and I think our hospitals are sitting pretty well. We're trying really hard to make sure that all of our elder care facilities have what they need. And then as we move down, we get into things like those that are serving the homeless, personal protective equipment for essential, those employees providing other essential services that aren't necessarily directly linked to health care, and et cetera. So I think we'll always have a need, and it would be wise for us to try to plan to have plenty on hand in the event that we have a reoccurrence of this virus in the future. I certainly have read that that's possible. And I think, and as I mentioned in my comments, from a public health perspective, the biggest key action that I can do to be prepared for that is to really ramp up our ability to identify cases and do that contact tracing. So the more rapidly that we're able to identify a case and reach out to all of their contacts and then quarantine or isolate them, the more successful we'll be in maintaining a lower level of illness across our community through whatever happens in the future.
Yeah, and I appreciate your comment there. I mean, it's I get it. We're in the middle of it right now, but looking forward, I don't want to. It's kind of like toilet paper. Make sure you got your rolls before everyone takes a run on it, right? But whatever we can do early for that second wave to be able to stockpile stuff, put in orders, or however that works. Hopefully, we're taking a look at it. Yep.
If Commissioner could add to that, one of the other things in addition to the work being done by our health department and HHS, Nicole Risler heads up our planning section in the EOC, and underneath that area this time we activated an advanced planning team, and they're looking out 2, 3 weeks, a month, 2 months, 3 months at those kind of activities and scenario planning. And some things may require us to bring back to the board and say, hey, we want to not do this, but we want to be able to fund this instead. And those are the kinds of things they're looking at, so that through the EOC, those kind of recommendations can come back to the board.
Perfect. Yeah, that's exactly kind of what I was asking. The second thing is, look, during this crisis, it's always a struggle because you're at least at the government level, you know, it's like a tug of war between liberty and keeping people safe as well, but protecting liberty. And I'll tell you, locally, I think you guys have done a great job, and really your county administrator has done a great job, but that's in consultation with you, the sheriff, and some of these other individuals, Rich. But, you know, we've avoided putting in place a curfew, forcing citizens to wear masks. You know, our boat ramps are open in the county, on the county side. We haven't overlaid additional regulations on businesses, and we haven't had any really aggressive crackdowns locally. So I think you guys are making the right decision. I appreciate it. I appreciate your leadership and your guidance, because I know a lot of the decisions that are made at the county level are reflected on basically your advice and your counsel on where we're at and where we need to go. So I think it's all working very well, and I just want to commend staff and commend you and appreciate your leadership and it's not just you, it's your entire team that's fueling you, obviously, but we appreciate them, and keep up the good work, and just always let us know on the commission side, what can we do to support you? What are we doing that we maybe need to adjust that we're doing wrong? You know, hopefully we have that open dialogue and let that continue, and I'm confident it will, but just know we're all ears. But thank you.
Thank you.
Great. I have Commissioner Dietert, then Commissioner Hines.
Okay. Thank you, Mr. Chair. Chuck, I'm glad you pointed out how many hours you've put in, along with your whole department. What we're looking at, we've cordoned people off and had them stay in place for over a month now, and eventually you can only keep those cats in the bag for so long where they're going to get restless and want to ignore rules. I think our people have been really terrific about following the rules, trying to be safe. So what we're looking at today really is a safe, smart restart, and you included the word slow, which I think we can agree with too. So in order for us to restart anything or open anything, we want to check with our health department first. So generally, when you look to open things, you want to make sure that your hospital is functioning not in a crisis mode. And I think certainly our public hospitals and private hospitals are not in a crisis mode. Wouldn't you agree?
Well, I would certainly agree they're not in crisis mode. However, they're still in a mode where they have what we call decompressed, so they've stopped elective services. They've basically emptied out any unnecessary patients, and so there is an economic impact to them as well. And so, again, the same caution words for them as they begin to think about how they move forward as well.
And as we slow walk this opening, they pretty much have to stay not doing elective things until we're sure we're out of the crisis, because we may need those beds should it erupt again.
I think we all are looking at the data every day. The challenge with this particular virus is I like to say 10 days ahead of us, because the things we do today, we don't really see the result till 7, 8, 9, 10 days from now. And so we're just very cautious as we watch the data and move forward.
There's part of our problem too is to overcome all the stuff on the internet, bad headlines, misleading information. I saw when Jacksonville opened their beaches, on the internet was a picture of Rio de Janeiro, at the height of season. And they were saying this is Jacksonville Beach, which it was not. So we have to overcome all this disinformation. And we have a public perception that that we shouldn't open anything till everyone's tested. Even if you tested all 426,000 people in Sarasota County, that's really just a snapshot for one day. You'd have to test them every day to be 100% certain. So do we have enough test kits to test people with symptoms?
We do have, I believe, adequate supplies to address those that are currently having symptoms. That's a question that depends on who you ask, because we're not always aware of who's asking for testing. We have a process at the health department for appointments for our what we're calling Popup testing. All of our hospitals do testing for those that are sick enough to seek health care. We still continue to recommend for people, if you have the symptoms, because there's really no specific treatment for COVID-19, that if you have it and you're not sick enough to need to go to the doctor or hospital, you should isolate at home and get better. The CDC standard in terms of when do I know I'm better is at least 7 days past the onset of your illness and at least 72 hours fever-free without the use of any medications. So that's the advice we give the majority of the people, and that really helps keep our testing from becoming
Well,
overwhelmed.
I'm not asking you to sign in blood. I'm just saying in general terms, not holding your feet to the fire, but if someone called their doctor and had every symptom on the checklist, they could then go get a test that day.
So
A
I don't,
Let me rephrase, because you're already going to hedge. A test would be available if necessary.
we make every effort to try to connect people with testing that have a need for testing. Our medical community is huge, and some physicians are more plugged into where testing is available than others. Others will tell them, call the health department or call the hospital, and usually we catch them as we move along. But I believe that the level of testing in our community is increased to a point where we can begin to say we're close to covering all of the ill people.
Have we, in the last, since you watch this every day, in the last 5 days, say, have we had a reduction? The other confusion is frankly between cases and deaths. Not every case results in a death. You could have thousands of cases and it doesn't mean anybody's going to die. But have we had a reduction in reported cases?
In terms of new cases, yes, we've seen it flatten and even begin to drop a little bit, so we're watching that closely. Of course, that can be tied to testing, but we feel like we're doing more testing now than we were certainly a month ago. And so we see all that as a good sign. And you're absolutely correct. I'm glad you mentioned there's a big difference between number of cases and number of deaths. And there's also a big difference between, sometimes you'll hear, oh, we've had a sudden onset of deaths across our community. It's important to realize, and I happen to have the data with me, even though I didn't know you were going to ask that question, but especially when we look at our elder care facilities, the range of illness to death is from 1 day to 47 days for that group, and the average is about 15 and a half days. So people experience this illness, and death may not come if it does for 40 up to 47 days so far in our community, or an average of 15 days. So it's two different things, looking at the total number of deaths versus when did people become ill. Those are really important questions for me, because when people became ill is when the disease is being transmitted, which is what we're focused on trying to stop. The other healthcare professionals are working hard to prevent death and poor outcomes, but public health is focused on disease transmission.
Okay, and the other question is, there's currently no cure, and regardless of what you see on TV, there's drug testing going on, but there's no drug readily available to the general public should they get sick, is there?
Not to my knowledge. There, as you say, there are a number of clinical trials going on right now with a number of different treatment maladies, some involving drugs, some involving serum. Some of those are seeing some success, but it's, as with all of those trials, it takes a lot of time before the community agrees that it's a valid treatment.
So people that think we should wait until there's a drug available, that could be 18 months from now, by the time it's approved, manufactured, and available to the general public.
Well, I'm not a manufacturing expert, but I would agree it's not going to come quickly.
It's not in the next 2
Nor will a
weeks.
vaccine come super quick.
So it wouldn't be June 1st or July 1st, probably.
I don't think it would be this calendar year.
Okay, thank you.
Commissioner Hines.
I just think it's important for people that are watching this. I need to follow up on a theme that I think it has been mentioned several times this morning, and Commissioner Ziegler has mentioned it, that this board makes decisions based upon evidence. And you're an expert in these fields, and so are some other folks that are going to talk to us today. We're not making decisions based upon sensationalism or emotion. And unfortunately, I think some other elected officials throughout our state have done that. So we are relying on you all to bring us the truth and not hold anything back so that we can make decisions. Now, that's overall. Now, let me go back to a couple questions that Commissioner Dietert brought up, and I don't have a question for you, but sometimes we have to speak through you to talk to other people and talk to each other because of the way things are set up. This is our third public meeting that I can, recall that we've been doing it this way. We are here, all 5 of us are here. There's opportunity for the public to speak to us. Cities have meetings. The city of Sarasota had a meeting on Monday. Every day we get information from our county administrator. Mr. Henry, I do not believe you are shy. I do not believe Rich Collins is shy, Sheriff Knight, Wayne Appleby, the Salvation Army, John Thaxton, Bill Spittler, the Sarasota Downtown Association, the Sarasota Chamber. I don't believe any of them are shy that if they don't believe that way that we have been working with this homelessness issue is wrong, that they would not be here to talk to us face to face, or at least send us an email or a letter that says, what you're doing is incorrect. You need to change it. And so it's so important that we don't make decisions based upon a letter to the editor or an opinion article that comes in that is not based upon expert testimony that we are receiving here. So if someone that writes an opinion article wants to come in here and say you're doing it wrong, come here and tell us, and we can ask our experts face to face, are they correct? Are we wrong? And I've known you and you guys, and Commissioner Mayor, you mentioned this, that he did the same tour for me. And I feel that we have a working relationship with you and the other people on our staff that are professional. They're not afraid to talk or talk truth to us. And so if there's a problem, then you're going to tell us. And I say that today because if the way we're handling things or the way fundings are going, or that you feel there's a problem with this, it's today that you need to let us know. And so if there's anyone else that's watching, we'll be here for a couple more hours. Get over here and tell us face to face, you're a couple blocks from this meeting place. You can make it over here. If you think these folks are wrong, you come tell us. Otherwise, running to the newspaper and scaring our community is not the way we want to make decisions coming out of this. Thank you.
I have Commissioner Ziegler on the board.
Look, I just want to follow up on that. You're exactly right, Commissioner Hines. I appreciate every single word that you said. We look at some of these other entities that have jumped to really take away, arguably take away people's rights, but then they realize they made a mistake. There's counties surrounding us that I think have made some mistakes. I mean, we've seen some counties enact curfews and then a couple days later remove the curfews. And a lot of that is because they are, maybe reading the newspaper, getting a little bit worked up, or they're just rushing to act rather than really thinking this through. And again, I think our staff has done a phenomenal job thinking this through. I appreciate the leadership on the commission. I appreciate you guys all showing up, having the meeting in person. I think that's good. I think that's a great display. But really, I think the steadfast leadership that we've had with our county administrator and our county staff has helped us prevent enacting something only to quickly realize it's a mistake. And look, if you look at the numbers, I mean, you can compare us to some of these other counties that have enacted more stringent measures, and our numbers are better, even though we haven't gone aggressive in some of these things. So, I think we all want to keep everyone safe. We all want to, but we want to do it smart, and that's what we're focused on. So I really appreciate your comments. I think it's a great point.
I have nobody else on the board, so I want to pile on here a little bit. Chuck, since the very beginning of this, way in the beginning, you've done a tremendous job educating this board and educating the public to the serious nature of this virus, but most importantly, how to mitigate the damage of it and the impact. I don't think it can be ignored here as giving some recognition to our communications department here at the county of taking that information and making sure it's pushed out to the community as best as we possibly can. But most importantly, I think it has to be recognized here, and I think our voters and our residents of this community are incredibly smart, and they can see through some of the stuff that Commissioner Hines and Commissioner Ziegler mentioned, and I'm just completely impressed by the personal accountability of some of our residents of following these suggestions and the suggestions of other healthcare officials. I don't think there's any question that this behavior has saved a lot of lives. So I don't know if I'll ever have the appropriate words to give you recognition on this, Chuck, but just a simple thank you for today. Mr. Lewis, did you have something further?
I just wanted, when you're done, I wanted to update the number that we provided because one of Mr. Henry's employees, Wayne Appleby, provided us an updated number to the people who've been housed, including the sheriff's homeless outreach teams. 80 through the COC, there's been 88 people housed since March 1st as part of that process that were ready to receive that.
Okay. Anything further for Mr. Henry? Seeing none, thank you again, Chuck, very, very
Thank you.
much. Mr. Lewis, to you.
Thank you. Mr. Collins will make his way forward after he gives Ms. Springer the appropriate amount of time.
Mr. Chair, Commissioners, Mr. Lewis, good morning. Rich Collins, Emergency Services Director. I will take a few minutes and dive a little bit into some details and provide some of the work that's being done by the various teams supporting the response for COVID-19. As I mentioned last time I saw you, we are 56 days in since the EOC began leaning forward for the response to COVID, and 38 days since EOC has gone to level 2 activation, operating 7 days a week. I think to echo some of the words of the commissioners and the team, the group works very closely to monitor what's going on at the governor's level and what's being done, and think thoughtfully through the executive orders on how we identify what I like to call the sweet spot on how we respond to ensure the best response for recovering and for this incident. As we do that, we maintain a battle rhythm, as I've talked about before, of multiple meetings at the EOC, producing flash reports on a daily basis that are widely distributed amongst our various partners as well as all of our employees out on the line. All of that supports the incident action plan, which is what we utilize to produce what we'll be doing on a daily basis from the Emergency Operations Center, and that includes daily objectives that advance the response and recovery for this incident. I just want to take a second to talk about that. Since the beginning of the activation, the planning section team led by Nicole Rissler and our advanced planning have put together 81 objectives that we've completed for this response. We're currently working on 15 that are in process. As Mr. Lewis mentioned, we have an advanced planning team that is looking out more than just what we're doing tomorrow, but weeks and months out. So some of the objectives we're working on right now are reentry plans for staff as we begin to unwind or look at how we unwind and making recommendations on that. Staged reopening of in-person services at our county buildings. And we're getting close to hurricane season. And COVID may still be in the community as we move into that season. So our advanced planning team in the EOC is already working on plans for how we deal with shelters and hurricane evacuation centers if COVID is still in the community at that time and we have issues with that, as well as staffing for our Emergency Operations Center and how we would deal with staffing and ramping up for a hurricane impact in our area. Not things that we want to talk about, but things that we have to plan for. We also are working with distribution of produce through All Face Food Bank to help those in need. We're making plans on how we deal with the summer camp through the Parks and Rec team, and evaluation of school closings on our workforce. And we continue to monitor and look at the impact of the task force recommendations that are coming forth through the governor's office and any potential executive orders from there. We continue to support the health department in their community testing program. That's a variety of folks that are helping with that, whether it's the sheriff's office, Parks and Rec, our city PD, others that are helping in that process. And we continue to deal with the first response within the community for COVID-type calls. Law, fire, health are all working extremely well together. At last check before I came in the meeting, right now the flu-like symptoms COVID response calls are about 21.6% of the fire department's response to the community. And there's a couple things that I would like to add in there. As I mentioned last meeting, we separated EMS from fire, so our fire units are maintaining in the stations, and we've implemented rapid response vehicles in each battalion. That has done a phenomenal job. I can't talk enough about our first responders out there in fire and EMS, but because of that, I think it's made a tremendous impact on our level of use of PPE within the community and our ability to protect our firefighters and paramedics. As I went in the meeting this morning, I asked our EMS chief, and as of today, there is not one firefighter or paramedic that's currently in isolation from an exposure potentially to COVID, which is a huge accolade to the response and what they're doing out in the community. Yesterday, they responded to those rapid response vehicles, responded to 66 COVID-type symptom calls in the community. On Saturday, that number was somewhere around 95. So they're extremely busy doing phenomenal work out there. And when we look over at how we're doing that process, there are other departments around the state that have taken what we've done and implemented in their department. Places like Tallahassee FD, Jacksonville FD are doing, have utilized our plans to help as they do the same types of work. From a hospital perspective, from a regional resource hospital, we're at 49% of ICU beds occupied, which is down from last time I was here talking to you. 54% of our hospital beds are available, and we continue to monitor that on a daily basis. I do want to talk a little bit about one of the primary components that I mentioned last time here is PPE and critical resource allocation. That's primary role for an emergency operations center, to identify critical resources and push those resources to the people that need them or the agencies that need them. Since I was here last time, we've received 5 additional shipments from the state. That is a total of 14. We've assisted over 150 healthcare facilities through that process. And it's not an easy process. Initially, each agency provided a resource request that went to the state. They had an allocation process based on burn rates and other things that they would then send shipments in, and those shipments would be identified for each agency. Well, if you can imagine 67 counties across the state, it's been very difficult for them to keep that up. So we started receiving shipments that just had stuff. And so what it's required is Chuck's team, our fire chief, and multiple other folks working together, general services, walking through and contacting ALFs and assisted living facilities and other agencies to ensure that what they're getting is what they really need, that they're within a 10-day supply. So there's a lot of effort being done by multiple departments, Parks and Rec, FD, capital projects, general services, health. They're all working together on that process. And to Chuck's point earlier, I'm not aware of any specific facility that has a critical resource that's not been met within the time frame since I've last talked to you. And so we've received more than double the amount of N95 masks since last time I saw you. We're at 37,850, 350,000 procedure masks, 140,000 gloves. So to the commissioner's question earlier, I think we're swimming. We're getting the supplies out as they need them, and that's something that we're monitoring every day as we move forward. I do want to take a second. I know Mr. Lewis mentioned the communications team and the incredible work they're doing, signage, I mean, all the things that they're doing to help us get the message out. And that is resulting in over 750 contact center calls per day that they're monitoring and working through and taking care of and helping us. So that's a phenomenal amount of work there. I talked earlier about work that was being done on logistics related to support of potential feeding for vulnerable communities. And that team, the health department, our EM, All Face Food Bank, all of our co-ed partners, been doing a phenomenal job. We're monitoring and tracking 211 feeding inquiries on a daily basis. We have a process that identifies a number of school meals, vulnerable meals that are being served per week, and trigger points, and monitoring what that is in the community on a daily basis. So for instance, in the week of 4/12 to 18, over 38,880 school meals were given out by the school district. Phenomenal work there. 273,371 meals to other vulnerable populations for a weekly total of 312,000 meals. Since this has started, since 3/23, the schools have supported 71,598 student interactions with 143,000 meals served. And so we're tracking that work on a daily basis to maintain and identify if there's any needs within the community. We're also tracking new unemployment registrations, a number of things to try to help identify where we might see problems in the upcoming weeks or months and how we can support that need. Finally, from a reimbursement standpoint, and I'll move on, since this has started, right now our estimates are about $1.7 million in disaster estimates for this response. Obviously, we're working and tracking. Our grants team and OFM is doing a phenomenal job with all of the departments and every employee that's working for this response doing daily logs so that we can work for reimbursement when this is complete. But then we also monitor the other programs that are out there. As mentioned earlier, we're working with the Continuum of Care Committee that is developing the plans for how we would utilize the Emergency Solutions Grant that's been mentioned, the $508,000. There has to be a plan and a process for that funding to be spent, and they're working through that. And it allows for a number of activities that are related to keeping people from going homeless and other actions. So the team is working on that. And then we also are looking at EMS funding that may be coming in through the CARES Act to help offset our costs for transportation of patients to the hospital. All the departments are supporting this operation. They're doing a phenomenal job. I know I've mentioned before, libraries producing masks that are being used by our employees throughout the community. Our bus operators are out taking care of folks that need to get to work and getting them through that process. So there's just a number of things going on. If you have any questions, I'll be glad to answer them.
Any questions for Mr. Collins? I have none on the board here, Rich. I'd like to say I'm so glad you brought up the hurricane response preparation. Normally this time of year, you'd be really gearing up for that, which you still are, which is getting lost in this, and I think it needs to be recognized. Everything from dealing with the supplies and staffing levels and coming up here dealing with some of the financial constraints and how to deal with some of that. So I really appreciate you bringing that up in this public forum. Obviously, there's lots of activity outside of this meeting, but it never hurts in a quick summary in a public meeting to make sure that the taxpayers know what you're doing there. So appreciate it very much. Oh, I do have Commissioner Hines on the board.
Yeah, I just want to fill you all in, Rich. I appreciate you, because I asked him a question the other day, thinking, now that this past week when the schools have been officially shut down, they're not going to reopen, is to fast track as much as possible the evacuation center that's being done at Taylor Ranch School, so that when we go into this, now that they know they can start construction tomorrow, if we could push it a little bit. And I shared that with the school board as well, because obviously we needed that space anyway, but like he described here today, the idea of spacing, if that is needed, with the cots and the beds, it's not going to cover as many people as maybe as it did before. So we need all the space available. So, and I know you've worked on that, and Jane Goodwin, and obviously Commissioner Ziegler and his wife. I mean, that's just something, let's get that done before we get deep into the hurricane season. So, thank you.
Couldn't agree more. Anything further for Mr. Collins? Please pass along our thanks and appreciation to your staff too, Rich. Thank you.
Absolutely, thank you.
Mr. Lewis.
Thank you. Mr. Rob Lewis will come forward and give a brief update. He's not going to talk about the work he's doing with the EDC specifically, because we're going to talk about that later, but some of the other activities that occur through the business and industry function out of the EOC. Mr. Lewis?
Thank you, Mr. Chairman, Mr. Lewis, Commissioners. I'll be very brief. My role in this activation is to be the business and industry liaison. And so in that regard, we've worked hard to establish a small business recovery roundtable, which I have meet weekly. I also have established a economic development recovery staff roundtable, which I also call together weekly so that the cities in the county staff levels are very well coordinated. Make numerous calls during the week to check in with our business leaders to see if there's anything more that I can be doing. We're also very carefully tackling the state and federal legislation and trying to forward that in as much real time as possible to our business leaders and to the board. And then lastly, trying to keep in routine touch with our delegation staff so that they're aware of county actions, so that as we move through this event, they're in step with knowing what our actions have been. So for the purpose of expediency, Mr. Chairman, I'll stop there for any questions.
Any questions for Mr. Lewis? I have nobody on the board, Rob. Thank you so much. We'll see you here in a little bit. Mr. Lewis, anything further?
If it's okay, Chair, if you're comfortable moving into talking about some of our reentry, specifically the beaches, or I don't know if we need a brief break or anything before that, or?
Well, unless there's a different thought from the board, my thought would be is that if, depending on how long you have, we'd go through the public hearing of just doing the upon request, which is agenda item number 33, and then take a break. But,
At your pleasure.
Yes, let's do it.
sound fine?
The only thing I'd like to be sensitive to, not to get to other longer discussions, so we can release Mr. Henry, because he's going to stay for the beaches conversation. So the PUR is great.
Well, that easily
sir.
that easily made the decision. Let's keep moving then, so we can get Mr. Henry out of here when he needs to be out of here. Yeah.
So, as Mr. Collins mentioned, and they're here to yell at me if I get anything that they don't think reflects what we've been working on in reentry plans. So it's not just the beaches. The beaches are a discussion point, but certainly we've been working on, as Mr. Collins said, any place where our employees have face-to-face activities with our community members. So, for example, the libraries. What do reactivations look like at our libraries, and how would you stage it so that it's both safe for the public health issues, as well as our employees? All those plans are part of that planning group that is going on at the EOC. One in particular that I'd like to spend a little time on today is what I'm recommending as it relates to our beaches. People like to use words like reopening. That's not quite where I'm at. My recommendations have to do with reactivating and reducing some of the restrictions at our open spaces. And the only open space that we have not allowed the essential activities identified by the governor under his executive order 20-91 is our beaches. That's the only park we haven't done that at. So what I'm recommending is April 27th that we go to restoring that level of service at our beaches. That's fishing, biking, running, walking, surfing, those kind of things, again, identified as essential activities by our governor. But not things like bringing in a cooler and setting up a canopy and spending the day at the beach. Some of the factors that have gone into this, we've looked at the parking. We've torn this 5 different ways, more than that. My recommendation is the parking to remain closed. And part of that has to do with phasing in this plan so we can get to what's needed down the road, which is ultimately a full opening of our beaches. Again, working with our health department, as you all have mentioned, and talking to him about his advice and what that looks like, particularly our sheriff's office and what that means for their resources and what that looks like for them, what it means for the public and the public health by doing it this way. And very importantly to all of us is what that means for our employees who are working out at the beaches and interact in those places. We think we can do this with the parking closed, encourage only those activities identified by the governor, and maintain that like we have our other open spaces, the Celery Fields, Rothenbeck Park, so many other of our neighborhood parks, and then ones that we don't manage on a day-to-day basis, but they're ours. Somebody else is just doing it for us, like Nathan Benderson Park, which is there as an open space essential activity for our community. So again, there would be no congregating, no gathering. This would be really geared as, throughout our county, we have open space available. Please take advantage of that open space near you, but there won't be any parking under this plan available, and please prepare accordingly. I do want to mention a couple of things. This is very consistent with what Longboat Key has done all along. They closed down their access points for cars and parking, but they've left it open for these essential activities. And Charlotte County yesterday had a very similar discussion, and the board authorized their county administrator. They really want to work in unison with us. That has been clear, and certainly Hector and Sherry and Manatee and I talk regularly. Manatee's not quite there yet. They have some other issues they're working on, but she sees a future where this very similar recommendation would go to their board as well, just not yet. But Charlotte's ready to pull the trigger with us if this is the direction the board supports, and it is my recommendation.
Okay, I've got Commissioner Mayo, then Commissioner Dietert, then Commissioner Ziegler.
Thank you, Mr. Chairman. First, before I get into my thoughts, I've been working hard at building a relationship with the new mayor of Venice on behalf of all of us. Quite frankly, when I substituted for our chairman at COG, he and I had a follow-up meeting for an hour. He did ask me, this is his reflections and his opinion, that he would not want to see the beaches opened, period. That were his thoughts. I told him that I would transmit it and not change what he was saying. He's very concerned about that. As for myself, I've always felt that allowing the walking, jogging, swimming, fishing, surfing is appropriate, but only with the parking lots closed. Just my opinion. And with the parking lots closed, that comes with the understanding there are no blankets, coolers, umbrellas laying out on the beach. It's for those activities. And one of the things that I always wanted to see so that we're not swamped is compatibility acting in unison with Charlotte County and Manatee County. So those are my thoughts on this. And I think everything that somebody said before, it might have been Commissioner Ziegler, that we've not been overbearing in our approach. Parks are open, but the playgrounds where the kids touch everything are closed. We did not put a curfew in. We left our boat ramps open. There's a lot of confusion about that because they think they're closed. Those would be the city of Sarasota. So I think we've been very calm, rational, technically competent, and I think it's a credit to administration, but also to you all, that this is the third time during this situation, along with the county attorney and the county administrator and some staff and Ms. Rushing, that we sit here in public so they can see us and interact with. That is extremely critical. Several of us were on a virtual type call for another organization on Monday, and my goodness, I do not know how we could run this meeting that way. So you all could speak for yourselves, but I see the two commissioners who are on it with me laughing. Speaking just for myself, I will be sitting here every time, and I think we do a good job. And my emails, I didn't count them. They're hundreds and hundreds and hundreds, but about 40% say close the beaches, 40% say open the beaches, and about 20% have a variation, their thoughts on how to do it. Thank you.
Great, I got Commissioner Dietert and then Commissioner Ziegler.
Okay. Well, when the coronavirus first started, and people got to where their sense of humor was returning, there was kind of a joke on Facebook of a man laying on a beach and he drew a big circle in the sand around himself for social distancing. I'm now starting to look at that as a practical solution. I mean, it's no joke. Right today, our beaches are closed. We have restricted beach access. So I think what you're proposing is not totally open the beaches, but relax the restrictions. I would certainly support that, and I think it's timely that we're discussing health issues today because this has to deal with mental health. People are getting so cooped up that they not only have cabin fever, but they're almost getting used to being isolated. And people that have anxiety and have other issues, this is terribly unhealthy for them. It would be more healthy to be out in the sunshine, walk the beach, get some exercise. Exercise is always good for your mental health. When we're talking about this, I think we need to emphasize that this is a relaxation of restrictions, but there still are restrictions. I would expect to have social distancing on the piers. If you're fishing and you can't stay 6 feet away from the next fisherman, you need to be asked to leave. No group activities such as beach yoga, the drum circle, the guy who thinks he's putting on a volleyball tournament on Siesta Key. I don't see where any of that should be happening right now. This should be totally about kind of restoring your physical and mental capabilities again by having access to the beach. I would like to see us, I would agree that closing the parking lots is the best way to limit. All the beaches should be open the same day so that there's not a congregation on one. And I would like to see a plan to phase in opening the parking lots because it is a little discriminatory. If you're within, a mile of the beach, you can walk down there and, have all the entertainment you want. But if you're 5 or 6 miles, you're going to have to drive a car, and we will be experiencing problems. Siesta Key maybe in particular, where they're going to come anyway and park wherever they feel like parking. So I would like to see a phase-in of parking within 2 weeks. And, but I do think we need to have a list of what is still restricted, and it's basically any group activities or any activity that would attract a large audience.
Commissioner Ziegler.
Yeah, look, I appreciate bringing up this discussion and everyone entertaining it, and the county administrator's leadership on this and providing, kind of an outline for us. Look, for the same reason that makes Americans great is the same reason that makes them restless. I just fundamentally believe Americans are doers. They're producers, they're inventors, they're workers, they like to deliver, they like to work. And right now we're in kind of challenging times because everyone's kind of cooped up, and I think people are going a little bit stir crazy. You can only keep the lid on America for so long. And I think that this is an important discussion because from a county perspective, it does show movement towards, really releasing Americans and letting them get back to doing. And specifically for the beaches, I mean, this is what's so interesting about this topic. A lot of people, obviously, we've gotten emails on both ways. And I mean, I think the beaches are probably one of the easier decisions that we're going to have to make throughout this crisis. We look throughout, I don't know if a lot of people realize, but throughout this entire crisis, all of our parks have been open. Legacy Trail has been open. I mean, we got a 10-mile, bike path going through the woods and people going right next to each other all day. It hasn't been a problem. We haven't heard of any issues. Benderson Park, which is a very well, it's used by a lot of people. I drive by there a bunch because I live in that area. That has been open. So what hasn't been open is our biggest park and our biggest facility, which are our beaches. I think our boat ramps have been open the entire time as well in the county. I think that's important. I understand the city closed theirs, but people need to realize that we've kept our county boat ramps open. I think it's important, as Commissioner Dietert mentioned with the parking, this is a public access issue. Look, if you're wealthy enough and you worked hard and you earned your money and you're very fortunate to live on a beach, that's great. You have a dock in your back, you can access the water, but there are a lot of citizens that pay for that beach that live inland that may not have that direct access. So I think opening up the beaches for them is important. I think it's great for people to be able to go out and get fresh air. I think that's a key thing right now. One of the, I get it, the coronavirus is a horrible time, this is a bad crisis. There are some positives that come out of this, and I think people are spending a lot of time with their family. You have mothers, you have fathers, you have sons, daughters, all getting together, spending a lot more time. This gives them another activity that they can do while they are, restricted from possibly going to work. There's debate about the virus. I mean, maybe Chuck Henry can touch on it, but, about sunlight and heat and what that does to the virus and is it safe or is it not? Those discussions happen. I think social distancing on the beach naturally happens. Even if it was fully opened, I mean, when's the last time someone came over and set up their chair and their cooler and their umbrella within 6 feet of you, right? I mean, that's an invasion of personal privacy. Commissioner Dietert, I do appreciate you pointing out that image. I did see that and start laughing about the guy with the circle around him. But, you look at Charlotte County, that was brought up, I think yesterday, they actually voted to fully open up, didn't they?
They voted to do basically what we're proposing. Yeah.
Okay. So, they've made the decision to open up. And then, for me, I think it made sense to close during spring break because spring break, I mean, the whole goal there is to get groups together and have fun and join your party with the next party with the next party. And that was a little bit of a risk. So I think it made sense for us to close then. Personally, I would be in favor, fully opening up. But I am willing to, kind of meet in the middle on this because I think it's important for us to take some steps forward. The parking, I don't really like the parking lot being closed, to be honest. I think hopefully there's a way that we can, either whether it's phasing it in or 50% of the lot is open. I think it's important for the public to be able to go just like they can at any other facility that we have. I think it should be treated the same. I do like that you're talking about possibly opening up on Monday. The nice thing about that is it avoids a weekend rush. There are still people obviously working from home that maybe on Monday they can't go, but they want to get back to the beach. I think it drags out any possibility of a rush on the beaches by doing it on Monday and letting the week kind of drag it out rather than doing it on a Saturday and then everyone kind of goes out there at once. So I think that's smart. And then I have full faith that the county is going to do a great job of communicating. I think our communications department's done a great job. The signs, everything else, let people know. So, I will support anything that moves us towards opening the county back up. I think that when it comes to the beaches, again, I will support, kind of the plan here if that's the consensus of the board, because I think it is an important step, and it just, again, as Sarasota County, look, COVID-19, just because we're opening up the beaches doesn't mean that we're not taking this virus seriously. This is a very dangerous situation. It's a dangerous virus, but we also have to be smart in how we react to it. And I think we've done a great job so far in Sarasota County. I think it continues with, hopefully this decision. But so that's kind of where I'm at. I hope the other commissioners, I look forward to hearing from them. But that's kind of where I'm at on the issue.
Okay, I have Commissioner Hines and Commissioner Mayo on the board. So we'll do Commissioner Hines, Commissioner Mayo. I'll jump in towards the end, and then we'll look to try and give staff some specific direction on what we'd like to go forward with as a consensus. So Commissioner Hines and Commissioner Mayo.
Thank you, Mr. Chairman. I think we're getting there in regards to each of ours opinion. I fully accept the administration's proposal. I think it's, again, as we've done throughout this, is a measured proposal to allow folks to have a little more space to get out. Opening the parking lots completely at this time, I think, would be a little too much. We'd have, I have 2 kids home from college right now, and I can tell you, if Siesta Key Beach was fully opened, even though as much conversation I've had with them, that's where they would go. And I would see that happening, and we're not quite there. We need a few days, I agree with the administration, waiting till Monday, because we need to do a lot of public service announcements and education on, what's available. Right now, you drive down I-75, and there's things, public beaches are closed. So if we're going to change that, or, think through that on how we not advertise what Commissioner Dietert was getting at. This isn't the place to go and have a party. It's the place to give more opportunities to walk, get out in the fresh air, get out in the sun, similar to our other parks that have always been available. So I support the administration's proposal. Thank you.
Commissioner Mayo.
Yeah, just real briefly. I think one of the things that we're getting known for is the way we treat each other here, the way we act in public, and the way we act when we're in session. And I laid out the things that I wanted to see, and there seems to be general agreement, enough votes for it to pass. But in the spirit of how we treat each other and what we're talking about here, maybe the next step we could weigh in on is we meet again in 2 weeks. And maybe that's when Jonathan brings back some sort of a plan on some sort of opening of the parking lots. It resonates with me. I've heard it from people that if you live 5-6 miles away, you're probably not going to bike, you're certainly not going to walk, but in the spirit of how we treat each other and the calm way we make these decisions, I'd be open to that.
Okay, great. I'll just jump in here, and then hopefully we'll give some direction to staff. But, we talked a little bit about this earlier, but as we sit today, unless you have been living in a cave, you know the seriousness of this virus, and most importantly, you know what to do to protect yourself. With that said, now that everybody's educated on this, I think it's time to open up our lives and be personally accountable to this. I do believe that our residents are being incredibly responsible on this. A partial opening, as described by staff for the beaches, I think is a very reasonable discussion. You know, I feel we need to trust in the public's ability to properly manage and protect themselves and others. With that said, to some specifics that the other commissioners were talking about, I think we're going to easily have a consensus here. I feel the coordination between Manatee and Charlotte County is critical. I think staff has done an excellent job at that in the past when the shutdown happened and bringing it back up. So I appreciate that very much, and I think Commissioner Mayo and Commissioner Dieter outlined that perfectly. Some of this stuff is hopefully a given, and maybe at the end of this you can comment, Mr. Lewis, is I'm having a given and a clear understanding that these restrooms sanitized, fully supplied for normal behaviors and traffic and visitors that we would have. And then lastly, regarding the parking, hopefully there's a meeting in the middle on that. I do have some heartburn over not opening the parking lots. I think it's going to create a sense of people going down there and doing a lot of parking in private property. And we're going to get a wave of concerns with that. With that said, maybe a very specific date. I'm just throwing this out there for discussion so staff can prepare. I'm just throwing this out, maybe Monday, May 4th, or maybe Monday, May 11th, where again, staff can prepare and deal with other folks they're dealing with and stakeholders from Sarasota and Manatee County. I'm just a little nervous about, with the parking lots not being open again, of what that would do to the private property and condominiums that are around there. So with that, I have Commissioner Dietert on the board.
Chair, I'd like to make a motion that's sort of open-ended. I think Jonathan certainly heard the discussion. We talked about, I think we're in agreement about the type of restrictions, no huge activities, just families and individuals enjoying the outdoors. So I think the motion could say that I move to open the beaches with restrictions. And then we could revisit the parking at our next meeting.
It looks like Mr. Lewis wanted to speak.
Well,
and then-
frankly,
There's a motion on the,
Yeah.
I can wait, but I do have some things I want to add to kind of the things we're looking at as we go forward, just when you guys are done.
because frankly, with just a general vote, it's open-ended,
Yeah.
and you can amend it at any time. We can amend it at the next meeting. We can refine it. This way, it's not delayed while you come back to us with something else. So it would simply say, move to open the beaches with restrictions.
I have a motion on the floor to open beaches with restrictions. Do I have a second for that?
Well, I'll second it, but I hope we're going to have just a little bit of discussion, because I just want to qualify one point here. So maybe that's after Jonathan wants to say something, or you, or you
When
want
you deem it
discussion now?
appropriate.
I have a motion on the floor by Commissioner Dieter, seconded by Commissioner Mayo. Commissioner Dieter, if you're okay, before you speak to your motion, Mr. Lewis having some comments? Mr. Lewis.
I just wanted to add a couple things that I thought I would get to during the course, but the conversation went very quickly. A couple of points. You know, we have our beaches here in Sarasota County as a county that are ours and we're responsible for our community. But we also manage some beaches for a couple of our cities. It would be my position in this plan that, you know, I've talked to both of those city managers, but, you know, if the city sent a formal letter saying they didn't want to activate those essential activities and relax the restrictions, that is not something we would, you know, make an issue of. That we'll do what we need to do with our facilities, just like we have with our open spaces. I believe we'll have great cooperation there, but this shouldn't be a point of conflict between us and the municipalities. I just wanted to mention that. And then I also wanted to mention, you know, there will be, just like we have all the way through this, between now and your next meeting, things will come up. You know, I talk to the sheriff, and our team talks to the sheriff's office routinely, And if there are things in between that we need to adjust because of how they're being impacted, you know, it's not just what he does out on beach patrol, it's not just what he does out on regular patrol, but, you know, he has impacts to the jail, all those kind of things that we need to be sensitive and mindful of, and we listen to regularly when the sheriff gets that feedback. So I want to make it clear, we will, you know, this motion is broad enough to give me that flexibility, and I just wanted to make that clear. We will continue to make those based on the consultation with the chief law enforcement officer in this county, which is our sheriff. So.
Okay, I have Commissioner Mayo on the board, then Commissioner Ziegler. Oh, I'm sorry, wait a minute. Is Commissioner Dieter, would you like to speak to your motion first?
Yes, I do think that it's something we can vote on today to give you permission to pursue those other avenues. We've already heard from Charlotte County. They've already approved this, which is very helpful down in South County because half of Minnesota Beach is Charlotte County and half Sarasota, so it seems a little silly. And I think with this motion, what we're doing is really codifying what's already going on. We all know that we could go down to the beach right this very minute and see people walking on the beach, probably swimming, but in a socially responsible manner. And we're just allowing that privilege for everyone else.
Commissioner Mayo, then Commissioner Ziegler.
Yeah, I just, I think we're handling the parking correctly right now, but let's remember that 9 days from now, we'll be back sitting right here. So that may be the time, we have not, the beaches are open. From the time we do this limited opening, 9 days later, we're sitting here. 13 days from now, we'll be sitting here, but 9 days from that opening. And we'll get to see what's happening. And at that point, we may all be very comfortable with some sort of opening the parking lot. We're not saying it's not going to happen for the next 3 or 4 months, because I have gotten the emails and I'm fully aware that we probably have 200,000 citizens that are miles and miles from the beaches. So I think this is a great step.
Commissioner Ziegler.
Yeah, I probably would have worded it a little bit differently, but, you know, I'm going to support this. You know, I think that it's pretty clear that what we're doing here is we're opening up the beaches for essential activities, which follows really the governor's order. That's how I would have worded the motion, but, you know, I think we're all kind of saying the same thing, just in different ways. But, you know, I think it's important for us to start taking steps forward. Again, the parking thing, you know, okay, I'll compromise. I guess you got to compromise in government sometimes, which is difficult for me to do sometimes, I think. But you know, hopefully we take a strong look at that, whether it's 9 days or maybe even before. You know, I'm not sure if that's an option, but you know, I want to commend our staff. I think they've done a great job. I want to commend our sheriff. I know he's willing to work with us anyway, you know, whatever decision comes out of here. I appreciate, you know, Charlotte County. They're good partners in this. Manatee County will work with them. You know, I think this is a good first step for residents. You know, we're going to have, even within 9 days probably, we're going to have a lot of decisions that are made throughout our society and our various levels of government. And it's time to kind of get back online and do what we can. And I think the beaches are a no-brainer. That's why I'm going to be supporting this. And, you know, again, it falls on our residents, which Commissioner Moran touched on, and I agree with. I think our residents have done a great job during this. You know, they've followed recommendations. We haven't had to put rules in place locally because they're following the recommendations first. So, you know, same thing with the beaches. Let's not, you know, jump and kind of go crazy, you know, when we open these up. You know, I don't expect to see a drum circle on Sunday, right? So, you know, stuff like that. But, you know, I appreciate the other commissioners, appreciate staff coming forward. I think this is a good step for the community. And again, in 9 days, you know, we can adjust it if we need to.
Okay, I have nobody else on the board. I agree, Commissioner Ziegler. Is it perfect? No, a little compromise on the parking. I totally get it. And that with Commissioner Mayo's deep and thoughtful and convincing arguments related to the timing of our next meeting leads me to an easy compromise on the parking. I have nobody else on the board, so I'm going to call the question here. Any questions for staff on this? Any further? Seeing none, I have a motion on the floor by Commissioner Dietert, seconded by Commissioner Mayo, to open the beaches with restrictions. All those in favor signify by saying aye.
Aye.
Any opposed? Chair votes aye, passes unanimously. Okay, excellent conversation. Mr. Lewis, do you have anything further?
No, sir.
Okay, then let's do this. Let's quick do this public hearing with agenda item number 33, and then we'll come back with Mr. Rob Lewis. So we are to the public hearing section of the agenda item number 33. The Sarasota County Charter requires that evidence and testimony presented during public hearings shall be under oath. Persons presenting evidence and/or testimony are required to complete and sign the request to speak card. Time limits are the petitioner gets 20 minutes, citizens' comments are 5 minutes per speaker unless otherwise determined by the chair, and petitioner rebuttal is 5 minutes. Again, we're to agenda item number 33, which is a presentation upon request. 33A is not a public hearing to adopt a resolution relating to the issuance of capital improvement revenue bonds, Series 2020, in an amount not to exceed $23 million to finance construction of the downtown cooling plant, facilities energy conservation measures, and East Jail controls upgrade, pay for capitalized interest and cost issuance, and provide certain other details. 33B is a public hearing to adopt a resolution, budget amendment number B 2020-022, amending the fiscal year 2020 budget for the issuance of capital improvement revenue bonds, Series 2020, and the amount of $10,933,812. And 33C, which is not a public hearing to approve design build energy savings agreement with Train USA Inc. for the downtown cooling plant, an amount not to exceed $14,807,731. Again, this is upon request. Do any commissioners want a full presentation on this?
No,
Seeing none, do I have a motion?
Mr. Chairman.
Commissioner Mayo.
We're on items 33A, B, and C. Move approval.
I have a motion by Commissioner Mayo on 33A, B, and C, seconded by Commissioner Dietert. Commissioner Mayo, anything further to your motion?
No, sir.
Commissioner Dietert, anything further from any of the commissioners? Seeing none, I'll call the question. All those in favor signify by saying aye. Any opposed? Chair votes aye. 33A, B, and C are passed unanimously. All right, let's take a real quick break here. Let's take a 5-minute break, and we'll come back to 34, agenda item number 34. All right, everybody, we're back. We are on agenda item number 34, which is public hearings, presentations that are scheduled for us today. Bear with me here. I do have something that legal I'd like to discuss and disclose here before we get into it. But first, agenda item number 34, A and B. A is not a public hearing to receive an update on the business recovery options authorized by the board and implemented by the EDC of Sarasota County and provide further direction and authorizations to the county administrator. And 34B is a public hearing to adopt a resolution, budget amendment number 2020-030, amending the fiscal year 2020 budget to appropriate funding for the Small Business Assistance Program in the amount of $4.3 million. Before we get into that, and I turn it over to Mr. Lewis, there was apparently some conversation with legal prior to this meeting and making sure that what we're doing here today, we're doing in the public purpose. So I will read a summary that's been provided by legal. The COVID-19 public health emergency and the necessary health mitigation measures imposed by the state have impacted the local economy of Sarasota County with a particularly significant impact upon small businesses. Small businesses in Sarasota County provide employment to a significant number of workers in Sarasota County. The survival of small businesses will help protect the public health, safety, and welfare, as small businesses will play a crucial role in the recovery of the local economy in Sarasota County. In order to minimize the impacts to the local economy and to promote the public welfare, the Board of County Commissioners of Sarasota County has created a small business assistance program to provide resiliency loans to qualifying small businesses in Sarasota County. The program is consistent with the economic development powers provided to the counties by Section 125.045 Florida statutes, which expressly recognizes loans as a viable economic development incentive and serves a public purpose. Based on the foregoing, the issuance of small business resilience loans provides a real and substantial public benefit and is recognized as serving a public purpose. At the end of this, if it does look like there's going to be a movement forward, I will then reread, which is going to be a delegation of the county administrator, where the county administrator would be delegated the authority to approve the issuance of the small business resiliency loans and to sign any documents requested for the loans. So with that, keep that in the back of your mind as we're hearing presentations from Mr. Lewis and ultimately Mr. Bullock. Over to you, Rob.
Thank you, Mr. Chairman and Commissioners, for the discussion today. I'll be very expedient so that we can listen to the salient points. My name is Rob Lewis, Director of Governmental Relations. I've signed a speaker card. As the Chairman noted, there are two items or actions today. One is to receive an update from the EDC on the Business Recovery Program, and secondly, a public hearing for a budget amendment that properly appropriates the monies for that program. Also, during the discussion, you'll have an opportunity to have some conversation with the Office of County Attorney related to the structure of the loan agreement. We also wanted to note that in the EDC contract, they cannot move more than 10% of their line items in their budget. We won't talk about that today. We won't have a recommendation today, but we want to note that so that in the future meeting, if the EDC needs to restructure their budget a little bit, they will. They have expressed, however, every intent to work within their existing budget, but we're asking to do a lot of different things than were originally intended with this agreement. And that will also hold true for their strategic plan and the metrics by which they measure that. I want to thank multi-agencies, the Clerk's Office, Clerk Internal Audit, EDC, OFM, the OCA, and my staff. And as I noted, Mr. Bullock is on the line with us. He's participating in the same fashion he did yet the last time on April 8th. And without further ado, I'd like to turn it over to him for a review of their efforts to this date.
Welcome, Mr. Bullock. You're recognized.
Thank you. Mr. Chairman, members of the board, Dave Bullock of the EDC. Can you hear me okay?
Can hear you well.
Okay. So I would quickly go through this program and touching on a few points that we'd like the commission to agree or delegate to the county administrator or however you'd like to do it, because conditions have changed somewhat since on April 8th. So first, a quick summary of the Resilience Loan Program for small businesses. First of all, you all know that it's targeting the Economic Development Incentive Fund, which has something over $4 million in it. We had required in our original discussion with you that you endorsed was the inclusion of as a requirement to get into the local program, the inclusion of a PPP application that had been submitted to a bank. For the past week now, the PPP program has been closed. There are businesses we are very aware of that were unable to find a bank to submit their application to, and in the past week, no bank has accepted it. So we're recommending we change the requirement of submit a PPP application to give to us a completed PPP application, along with the short web-based Sarasota County specific application. And I can just keep moving through these if you like. The maximum amount of the loan that you agreed on April 8th would be $25,000 based on categories of payroll, rent, mortgage, and utilities. So the applicant essentially fills out their payroll, rent, mortgage, and utilities expenses for the 2.5-month period that we'll have described in our guidelines and consistent with PPP. And that determines whether how much they're qualified for. It could be less, it can't be over $25,000. However, when it comes to the use of the proceeds of the loan, we've heard from businesses that the payroll, rent, and mortgage, and utilities are certainly important and should be allowable expenses in the actual expenditure of the funds. But there's a growing interest as we approach some type of recovery in adding those an additional 3 categories to the expense side. In other words, what they can spend the money on. And the 3 categories of expenditures that they've identified are insurance, marketing, and cost of goods. And these are really geared toward their reopening. So our recommendation is that when it comes to, we still keep the same qualifying criteria, but when it comes to expenses, we expand it beyond the qualifying criteria to allow insurance, marketing, and cost of goods. The terms of the loan are just as you discussed them on April 8th, 0 interest, no payment for the first 12 months, provided that the applicant or the loan recipient remains in compliance with their loan agreement. If they go out of compliance with the loan agreement, certain conditions kick in which are not nearly as favorable to someone who has received a loan if they decide to do something outside of the terms of the agreement. 3.5% interest rate on the balance after 12 months with a 3-year payback term, and the opportunity to convert 20% of the grant if the full amount is paid within the first year and they remain compliant with the loan agreement. And I'll continue on. Currently, the way this is structured, since we're relying on the PPP application, is that they must have a completed application and they must be eligible under PPP. And I want to point out, because we've heard the board wants to talk about this, currently the PPP allows 501c3s to be eligible, and they would, when we move this forward, if it is unchanged, they would remain eligible in the county loan program. Other criteria would be, must be 50 FTE employees or less. We know, especially in the restaurant and some of the other service industries, there's lots of part-time employees. We provide in our guidance document how to calculate the FTE, which is pretty simple. We did 40 hours as a divider there. So 50 employee FTEs or less. They must have a Sarasota County business tax receipt. That's what most of you know as a business license. We'll call it a business tax receipt. Its official name, BTR. They must have it for the past 3 years assigned to an address in Sarasota County. Under the PPP application, therefore under this program, sole proprietors, contractors, self-employed folks, gig workers, and so on are eligible if they have a Sarasota County business tax receipt for the past 3 years. And we know that some of those folks do not have that, but that is a gateway criteria to get into this program. Each applicant must attest to the hardship due to COVID-19, and that's also consistent with the PPP application. The idea and the notion of...
Mr. Bullock, can you hold 1 second? Commissioner Dieter has a question for you.
Yeah, I'm trying to find it on this page now. Could you go back one, please? Right. Yeah, before we move off of this, under sole proprietors, independent contractors, et cetera, is that our language or is that the federal language?
we've lifted most of this off of the PPP application. We added in the gig workers, so you can think of a Uber driver or something like that, just to give you a sense of who these people are. But again, the gateway to get to this local program is the Sarasota County Business Tax Receipt.
Because when it comes to, I mean, the purpose, our stated purpose, is to help businesses to keep their employees on their payroll and then have their employees in place to open up. A sole proprietorship, I mean, that could be a lawyer, a one-man office lawyer or insurance man, or, so is that our goal? And as we go through these, are you looking for changes to the language that you're offering up here?
Commissioner Dieter, we have included these points in here for exactly the purpose of the commission. Make sure you're aware of what's included as we go under the umbrella of the PPP. And if you want to change any of that, you have the opportunity to change it.
Because if I can continue for just a second, you did the right thing, and there was a template out there, which is the federal program, the PPP, which I was very excited about, but then you get to the implement. So they're a step ahead of us because they've already implemented, and then we get to benefit by that experience. And what we've seen is, under the 501c3s, not-for-profits, Harvard got $20 million. So I don't think that was the intention of the payment protection plan either. And so I question the 501c3s and the sole proprietorship. And we can discuss it later if you wish, but I just want to red flag those two items.
Mr. Bullock, please continue.
Okay, and we can come back to this page if the board elects to. Another issue that has arisen and the commission talked about on April 8th was how to secure these loans. And we've had great discussion with the county attorney's office and others and private businesses. And I just want you to make you aware of some issues that have evolved from the business community to think about as you further discuss how to secure the loan. Not requiring certainly a collateralized guarantee is consistent with the PPP loan terms. Some of you are probably very familiar with those. And as the business community talked about this, some themes began to emerge here. And so the risk posed by this event is not the result of any behavior on the part of an applicant, which is often the primary risk areas you're concerned about when advancing the loan. Further, no one knows when the reopening of businesses will occur or how they'll occur, or how that will occur. There could be reduced capacity, certainly in restaurants, but also in other types of businesses that customers go into the building. And there could be other limitations that we can't quite identify yet on future business operations. So requiring this personal, some type of a strong personal or other guarantee shifts the risk from this sort of worldwide unknowns to the business owner if that guarantee is a absolute rock solid and sort of based on traditional ways of trying to control the business owner's behavior. However, counterbalancing that, the use of public funds requires some kind of pledge to pay back under reasonable circumstances, and all of I would say that theme emerged as an understanding of the business community. So as you talk about this, I know the county attorney is prepared to have part of this discussion. I ask you to keep those things in mind. And the closest data point we have, and it's not directly relevant, but when the state advanced bridge loans as a result of Hurricane Irma, they have experienced a 40% default rate on those bridge loans. So I try to provide this page as background and information for your thinking as you have a discussion about securing these loans. I can tell you that the timeline for the program, we at the EDC, and I believe county are prepared to incorporate any changes we make that are made as a result of today's meeting. We'll modify our online application handling system to accommodate those changes. We look to begin accepting applications depending on the nature of those changes tomorrow at some point in the day. All applications would be submitted online until funds are exhausted. And I want the commission to understand that we have enough dashboards up on our program that we can tell the rate at which the funds are likely to be drawn down as we review these applications. So I can't tell you right now if the application process will be open, assuming we can do it tomorrow, for a number of hours or a number of days, but it won't be more than a few days. We're reasonably sure. As of this morning, we had 631 people signed up to receive a notice. The notice that we'll send out when the applications are available will go to all the media, the chambers of commerce, the trade associations, anyone on our contact list. We'll post it on social media. Certainly the county and all the municipalities also will get it. And everyone on this list knows it's coming. None of us know exactly when it will come. So there will be a push, and I guess my point here is we expect to know when our applications received will consume all of the funds, and we'll leave ourselves a little leeway. But one of the lessons that we learned in talking to the state about their loan program was they allowed the application process to accept 38,000 applications, and they only had funding for 1,000. And that turned out to be a really difficult situation because people were sort of led to believe that they might have a shot at this. We would accept applications up to the point where we're very confident that funds will be expended, and then we would stop the acceptance of application and let people know that the funds have been expended.
Mr. Bullock, before you go on to the next slide, I have Commissioner Dietert and Commissioner Hines on the board here. Commissioner Dietert.
Dave, that was going to be my question. I don't think we're going to need to send out notices to all media, chamber, trades association, et cetera. We only have 172 spots that we can afford at $25,000 a pop, and somewhere in here, 35 of them are dedicated to daycare centers, so that leaves 137 spots. And you already have 550 signed up to receive notices. So I'd say by Friday, it's all going to be gone. So that'll save you that. Aren't we doing this on, minus the carve-out, aren't we doing this on first come, first serve? So couldn't we say out of the 550, probably 137 of them qualify, so it's game over already?
So the reason that those are 550 people who have contacted us in one way or another and then signed themselves up to receive. So they're paying close attention. Yes, they could consume all of the funds probably pretty safely. How many of those will submit the necessary completed application, we don't know. The idea behind sending the notice out is so everyone gets an equal opportunity at the same time. And we are able to stop receiving applications when we think it's a responsible thing to do and we know that there's enough to receive funds. So the notice, the idea of pushing the information out is to broadcast it so everyone has it at the same time, not just people who were insightful enough to sign up, though, you know, they get some credit because they'll get an individual notice as well.
Okay. I think that's a good idea. It's like firing the gun to start the horse race, and they all start at the same time. Good.
Commissioner Hines and Commissioner Ziegler.
Thank you, Mr. Chairman. Let me do this now. I mean, my position on this was clear 2 weeks ago, and nothing's changed in regards to my position. So I just want to get some of these questions and answers in the record so you all can deliberate on how to proceed. Mr. Bullock, first of all, thank you, and thank you to everyone in the EDC for taking the time to do what we've asked you to do. You've done a great job, and I really appreciate that. So just to confirm a few things, Mr. Bullock, you know, in regards to, you went through your bullet points there. So just to make sure, the applications come in, there's no credit check or anything in regards to a review by the EDC in regards to the business's ability to repay this loan. Is that correct?
No, sir.
Okay. So,
Can I explain?
no, well, maybe, sure, if you want to, go ahead.
And when I said no, sir, I was literally answering your question.
Well, I think that's
There
all we
is-
need. Oh, go ahead.
Well, there is a process by the EDC to qualify these applicants, including, while the application is being reviewed, we run the background check through LexisNexis, checking for bankruptcies, felonies, other convictions, expired authorizations, all those types of things that begin to give us an insight into the applicant's ability to repay the loan. Beyond that, of course, then we are also checking and verifying the information they provided in the application. They have to, we will independently verify their business license has been active. We will independently verify the calculations for the amount of money that they're asking. They must also submit enough what generally is a federal tax forms that we can see that they have been in business for a period of time and their expenses during the period we're targeting justify their expenditure. So by the time the application comes out of the EDC, we will have a sense of the person's ability to repay the loan, mostly based on past behavior. We will know if there are bankruptcies, we'll know if there are felonies, and we'll know if there are significant outstanding issues that cause us to flag an application.
Okay, so that's a good point, and I hadn't heard that before. So you're saying if a person has previously filed bankruptcy, or let's say is currently in bankruptcy, you're going to flag that and potentially turn that down through their application process?
Yes, sir. Potentially turn that down, yes.
Who makes that decision?
So here's how it is likely to work in reality, Commissioner. We'll say my application goes in, and I have 3 bankruptcies in my history. As they're being reviewed, we're running the check on my background, and we discover these things, right? That reviewer then, as part of his training and instructions, remove that applicant. There's something wrong with that applicant we need to understand better. It is removed from the queue. And then it's assigned to a group of people who contact the applicants. Now, in reality, we believe we're going to have so many of these applications in such a short time that anyone removed from the queue stands a high likelihood of having us exhaust the funding before we're able to resolve all of those issues. That would be a complex issue for us to resolve. And it's likely to result in that person not being funded. But in addition to that, if there are bankruptcies and if there are felony violations under PPP and under our guidelines, that disqualifies the applicant for being able to get a county loan.
Okay, that's good information, because I didn't know that was a condition that this board had placed on you, that if there was something in regards to questionable, the ability to repay, that they would be flagged and removed. And I agree with you 100% that if it is removed from the queue, then they're, even if they can explain it later, they're going to miss this opportunity. So, board, I bring that to your point, to your information. You might want to discuss that a little bit more if that was your intent. Also, I appreciate Commissioner Dieter pointing out the issues at the federal level that was pointed out yesterday by the president, that the abuse in regards to the PPP that was applied there, and that needs to be discussed and make sure that does not occur at this level. So you talked, Mr. Bullock, you talked about past. What about the future? What is the EDC and the review going to look at as regards to the ability for an applicant who gets this money to have the ability to reopen?
So we cannot look at the unknown. I mean, there's no way for us to gauge the unknowns in the future. The decision to fund is based on the information provided, our ability to verify and investigate that, and their agreement that they'll spend this money on eligible expenses, all in the understanding that they're going to try to survive to reopen. But the future is not an evaluation criteria in this, and frankly, after spending a lot of time trying to figure it out, we don't know how to bring that in as an evaluation. If they've been a working business in Sarasota County with the BTR, submit the federal forms, they, driver's license, we have a variety of verifying techniques built in. We run our background checks. We're doing what we think is a reasonable level of diligence that allows us to say this has been an ongoing concern, but it does not look at the likelihood of them being able to reopen in the future.
Okay, thanks. Mr. Chairman, a few more, and I just, Mr. Bullock, you're putting in the record what I'm asking you, and you're being honest, and I appreciate that. So you talked about allowable expenses, so the applicant will verify whatever this board, if we amend it based upon what you've said today, we will use those for allowable expenses, but there's no verification after the money's given by the EDC or anyone else that it was used for that. Is that correct?
That is not correct.
Okay.
So the applicant is required to file ongoing reports once within a certain period of time after the loan is being granted. And that's measured in a few days, and I can't remember precisely. I want to say it's within the first 2 months they have to start filing the reports. And in those reports, they have to specify their expenses and identify them under the categories that, assuming we move forward as I've discussed here with you today, under the 6 categories that would be allowable expenses: payroll, rent, mortgage, utilities, insurance, marketing, cost of goods. And so they will need to justify their expenditures of these monies have fallen within those categories with every time they submit one of the required reports. And those, this really becomes part of the loan servicing, where the expenditures have to be matched with the allowed categories, and they've signed an agreement to that effect.
Okay, so walk me through that real quick. Someone applies and gets $20,000 based upon their application and verification of what they'll do. So many days later, or weeks later, or months later, they come in and they say, I paid the electrical bill, or I paid the insurance, or I paid the rent with that money. If they don't do that, then you would consider them in default of the loan agreement?
They would be required to verify those categories just like they are when they apply. So we would expect to see receipts and so on associated with those expenditures.
Okay. Let me move on to 2 more subjects and I'll finish. So last meeting, we talked about potentially identifying or creating a hierarchy of various businesses. We did a little bit of that in regards to daycare centers, but avoided the rest and said it's open to anybody that has a business license in Sarasota County. So just make this clear for the record, as I understand it, and correct me if I'm wrong, in that like a nail salon is in this application process is equal to a doctor's office, an adult entertainment type business or novelty store is equal to a dentist office, their manufacturing firm. I think I saw on your thing last night, the tattoo parlor, because they don't require a business license, would not be eligible, but if they were, would be equal to some type of manufacturing business. So there's no evaluation in regards to the type of business. Where is it? There, tattooing. So they wouldn't be eligible. But is that accurate? You're not going to review, as long as they have a business license in Sarasota County, they're eligible. Is that correct? For 3 years.
As long as they have a business license, they have a Sarasota County address, they've submitted all the rest of the qualifying information, including their expenses with the necessary tax forms that we require. They pass our background check, and I'm trying to remember off the top of my head, but I've listed for you here those types of businesses that are not required to have a BTR within the county. And the BTR is really the gateway we're trying to use, but we do treat, once they're in the gate, then all business are treated equally, all applicants, I should say, are treated equally until something in the review process calls them out as potentially not acceptable.
Okay. Again, first come, first serve, allocation throughout the county, North County, South County, East, West, that doesn't matter. It's just whoever gets their application in first that's complete. Is that correct?
Yes, sir, except for the daycare facilities, yes.
Okay. And I didn't know about this, this is my last question, Mr. Chairman. So move off the financial part, but if a business, are you researching at all in regards to businesses that may have pending code violations in Sarasota County? Is that part of your review?
It is not. We don't have a code violation. We have a bankruptcy for the past 7 years. A felony for the past 5 years would disqualify these folks. We do a small business credit report from Nexus Lexus. That's not the official, big 3 or 4 credit companies, but it is a very fast report. So those are the things that we sort of look under the curtain to see if the business is legitimate and has at least sort of what seems to be an acceptable track record as to bankruptcies and felonies.
Okay. Thank you, Mr. Chairman. Thanks for the time to get those points in the record.
Questions? Commissioner Ziegler, then Commissioner Dietert.
Thanks, Dave. Appreciate your leadership on this. Question for you. Well, I got 2 things, but number 1, have you had discussions with the city of Sarasota? I had a commissioner call me and said that they had $3 million sitting in an account and they wanted to see if they could piggyback on what we're doing and maybe work with you guys somehow. Has there been any discussions with the city of Sarasota?
Yes, sir. We've gone back and forth with the city staff on a couple occasions, almost, every day or so here for the past week or so. I don't know what the city's official position is. Our informal staff discussion has been, let us get through the county program.
Yep.
And we'll be fully committed. And then if the city has funds and is interested, we'd be happy to work with them because we'll have all this information and data and so on. So those discussions have been at the staff level.
Okay, cool. And then the other issue, the nonprofits, I know that was kind of bulleted earlier. I just want to let everyone know, I did talk to the Brannick Foundation, Kelly there, and, some of these nonprofits are set up, or some of these foundations are set up to provide assistance for the nonprofits as well. So just so you guys know, I had a good conversation with her. They have a couple groups that have come together to provide support that's specifically earmarked for nonprofits. So if we were to change that or make any adjustment, I think that they're going to be kind of picking up that slack, if you will.
Commissioner Dietert.
Commissioner Ziegler, I'm glad you had that conversation because the Bransick Foundation has been very generous in giving to the not-for-profits. And to address Commissioner Hines' thing about Harvard abuse of the system, well, they definitely took advantage of the system, but that was built in by allowing not-for-profits to participate. So I would today support just removing the word 501c3 and then no not-for-profits could participate because they have other avenues. They have state, federal, the community foundations, charitable giving, so they have other avenues for money that the guy who owns a pizza parlor doesn't have access to. So I would look to have my fellow commissioners support removing the words 501c3. And Dave, would that be enough to exclude the not-for-profits of any sort from participating in this?
Commissioner, just the way you stated it would allow us to prohibit, or if anyone does get in the door, we can separate them because we do require the identification of a 501c3 as a field on our application, and we did that specifically should this come up.
Okay. So I'd like to hear my fellow colleagues on that one. And I do applaud the work you've done. You've covered everybody. You've covered kind of the fringe workers too, the gig workers and self-employed, you know, grass cutters, people that are just doing their best to make any kind of living they can. And those are the people I think we have in mind, because we, once again, we're giving $4 million plus, but it could only cover potentially 172 people, and there's 16,000 businesses in the county. So we're doing our best. It's not huge, but it's something. And the criteria is very hard to come up with. Do you do the most deserving, the most this is like the yearbook, most likely to succeed, the largest, the smallest? And we have to realize that there will be a certain default rate, because by the time we start giving out the money and by the time they get anything out of the federal government, not to mention the state, a lot of these people are really on the edge. So, you know, we're going in there with our eyes open and doing our best to help at least 172 businesses.
David, I've got a couple other commissioners on the board here, but I wanted to get a feel for how long do you think your presentation, just roughly, I'm not rushing you, I just want to get a gauge of time here.
I think I only need another minute for my very last slide. I have 2 minutes max.
Okay, Commissioner Mayo, did you want to go now? Feel free.
Yeah, let me go
Commissioner
now.
Mayo, then Commissioner Ziegler.
After our last meeting, I'm sure we all did, I got a number of calls and letters and emails about this whole nonprofit situation. And my first response to the very first nice lady, and then I repeated it to the other folks, was, no, I think you're concerned. You don't need to be concerned. They have to qualify under the PPP. They have to be in business for 3 years, and they have to have 3 years' worth of business tax receipts. But I'm led to believe that that by itself would not exclude nonprofits. So I would, if Commissioner Dieter at a point in the future were to make a motion that this does not apply to the 501c3s, the nonprofits, I would support that.
Commissioner Ziegler.
Yeah, and just to be clear, again, I want to be very, very clear. We value our nonprofits.
Absolutely.
You know, a lot of these are business, just like technically businesses, I guess, but they have employees, they have expenses. We understand that, but there are avenues for support for them. And, you know, I think the program that we're talking about, or as Commissioner Dietert mentioned, is to, you know, get some support to the businesses that may not have access to those avenues. So I don't want any nonprofit out there, and that's a long conversation I had with Kelly on it, very positive discussion, is I don't want any nonprofit to think that what we're doing now is in any way a representation of us devaluing their importance to our community, because they play an important role. But I don't think with this program that's necessarily what we're trying to tackle, because there are other options for them.
I would agree with that.
Okay, Mr. Bullock, what I thought I'd do is when you wrap up, I've been making notes to your comments. I can summarize it for the board, and then I'll lay it at their feet for any type of motion. But go ahead, sir.
Okay, I think I've been through these. Okay, so our review process, as it stands right now, we would conduct the intake at the EDC on a first-come, first-served basis. Up to 35 of the slots would be reserved for childcare who have applied by May 1st. Once a applicant reaches a qualified status that has been verified, as I've described here today, and all the information is included, we would attach a standard loan agreement, which would be auto-populated by our system, and then the entire package is forwarded over to the county. The EDC at that point has completed its review work. All the documents go into the county's control. Now, the system we have built in our software called Salesforce can continue to be used within the county for tracking and reporting purposes, and the county's agreed to do that, and that's really important for keeping the applicants up to date on where their application is. There's a variety of county agencies that would be working on this. It would go into government relations, it would go through financial management, county attorney, and finally the clerk's office, who have all been working intensely on this together. The applicant would receive emails along the way as his or her application moves through the process, and at any point where it is removed from the process, they would be notified. As I mentioned before, incomplete applications or those that require contact would lose their place in the queue until all the information is received. So who are these reviewers? They are EDC staff. They're volunteers from a couple chambers of commerce, Venice Chamber, Sarasota Chamber. The city of Northport has allowed a person. Other companies and corporations, you see Art Lambert's company in there, has dedicated people, and a super effort from the Minnesota SCORE folks. The retired executives have been just incredible, and they are incredibly smart. The Building Industry Association and Gulf Coast Builders Exchange all have volunteered. Building this program out could not have occurred without the people you see on this list. I can tell you that the first two people on here for Form CB and Dealers United actually dedicated personnel to us at no cost to build out the software, and neither of those companies are eligible to receive any benefits. The rest of the names on here are people who have dedicated significant time to our efforts, and every one of them has been important and essential to our work. So that completes, but for one thing, as you're talking about the nonprofits, as we dove into the child care situation, it was pointed out to us that about half of the nonprofits serving about half of the kids, about half of the child cares are in fact nonprofits. That was just pointed out. I put it up there for the commission to consider in your deliberations. That completes my presentation.
Wonderful, David. Thank you so much. And before I just start here with a quick summary, I need to apologize to you formally. I already did it in an email. In the last meeting we had, we were deep into deliberations, and when we ended the meeting, I didn't appropriately thank you for just all the time and energy you have on this. And I know you're in retirement right now, and you just absolutely Herculean effort. So thank you so much. And also thank you to the community foundations and some various business leadership groups that have brought a lot of information to this board. Incredibly thoughtful, smart, some of it emotional, all of it valuable. So I do have one question at the end, but if I'm hearing you right, here's the summary. Feel free to interrupt me at any time on this, again, to lay it at the feet of this board, is that the PPP federal program obviously does not have much underwriting in it. It was a very simple application, huge filters. What you've outlined today would be any type of deviations from this PPP. For example, you are approaching this board with increasing the eligible expenses to include insurance, cost of goods, and marketing. You're looking for guidance on whether or not to include nonprofits. You are making a more filtered approach to the PPP by only allowing folks that have less than 50 employees. You are limiting it to people that pay the Sarasota County business tax receipt and have done so for the last 3 years. You are requesting whether or not a personal guarantee is required, which I'm assuming would have an affidavit in there to testifying to all the facts above and all the other topics you brought up. And you were looking for guidance on if you did not have enough applicants, which I think it's obvious you will, but if and when to close the application process, and I would suggest to this board maybe May 30th if that happens, and whether or not to continue to allow 35 slots for childcare. And then if that's a fair summary, again, I'm not doing it fully, but that is what you were looking for guidance from this board. So am I close in a summary?
I think you have it, Commissioner. I'm checking my notes, but you certainly hit the high points.
Okay, and then the only question I have before I would turn it over to the board for any type of discussion would be, is that we are still on track. I don't want analysis paralysis on this. We're still on track for a 5-1 to get this money on the street.
I'm going to have to turn to the county staff to answer that question. We will start sending reviewed and qualified applications over to the county within hours of receiving them. And we have 20 people dedicated simply to the review and quality control and background work, ready to go starting the minute we open the applications.
Okay, Mr. Lewis, anything to add to the 5-1 comment?
Mr. Chairman, as it relates to the 5-1, rest assured we've established a county internal process. We've involved the agencies I've mentioned before. That's always contingent upon the quality of something, but we have every confidence that when we get it on the county side from the EDC, our role is to verify that everything was supposed to be in there is. We've also established an extra team of staff to help with the processing, and we're in the process of training for that now. So to your question, we're making every endeavor to make sure we meet the May 1st deadline. If for some reason there's a shift in that, we certainly will advise the board through the administrator, but that is our direction, that's our goal.
Wonderful, thank you. I have Commissioner Dietert on the board.
Thank you, Mr. Chair, and I think my question is probably for Dave if he's still with us, and I'm sure he is. My concern is with background checks on the child care facilities. 50% of them are not-for-profit, so they're already taken care of. So then we're looking at the other 50%. Do we do any checks on abuse or any violations along those lines?
Thank you, Commissioner, for bringing that up. I failed to mention that as part of the review of child care specifically, we work with the Early Learning Coalition, and Janet Kahn's been great. We have the ability to immediately check their licensing, which we'll do. They have to be a licensed child care facility. And we have the ability to check the nature of violations that have occurred. And we have Ms. Kahn as a resource, because we're not experts in this field. If there is, as you suggest in some cases, a serious violation, we would actually have to consult with her to help us understand what that means. But the intent here is they are licensed, they are current, and they do not have, and I can't give you more detail than they cannot have significant safety and health of the children violations. We would consult with her for some guidance on that.
Well, since you have some help from Early Learning Childhood, they probably know how to navigate DCF's website, and generally abuse cases or any violations by a child care center would be a matter of public record. We just don't want to embarrass ourselves by rewarding the wrong people or finding out there was some violation that people feel we should have known something about. So as long as that's a factor, that would be fine. And did we solve the personal guarantee? Are we a yes or a no on personal guarantees of the loan?
My personal thoughts on the personal guarantee is, boy, it makes you have skin in the game. If you don't think you have the ability to pull out of this, and don't take the money if you don't think you have a good chance of getting out of this, and putting your name on it, I think takes all the gray area to that conversation. But I'm totally listening for a conversation from the board.
Well,
sorry, go ahead.
to me, a personal guarantee, I mean, we're trying to help people that are drowning, and a personal guarantee is like throwing them a brick instead of a life preserver. So they'd have to think 2 or 3 times before they want to go. A lot of people were very disappointed by the SBA loans after the last Irma or whatever, and they said, it took me years to pay it off, I'll never do that again. So I think we want to be a help, a personal guarantee for 25 grand. I just think we're going to have a default factor. I don't think it's going to be huge, and a lot of it'll depend on the screening. That's why I say, you know, you're going to have to look at who's most likely to succeed. I would be for not having the personal guarantee, but that's just my opinion.
I have Mr. Lewis wanted to comment real quick, Commissioner Ziegler. If you just wait 1 second, it might be relevant to what you're asking.
I'll certainly defer, Mr. Chairman, to Commissioner Ziegler. I just wanted Dave to also touch base a little bit on the topic of how long the recipient would have to expend the loan monies. We had some conversation about that at the staff level. Wanted to have that at least as a conversational point quickly.
So we talked about a lot of different things. We don't know when they're going to spend this money. They may hold this money, especially if you allow the insurance, marketing, and cost of goods category. This is more flexible than some of the money they have from the federal government. So they may use this money in their restart. So we know they have to pay it back. They have 1 year of interest free, and then their payments start. So rather than focus on when do you spend it, and they're still required whenever they spend it to spend it in those categories that we've talked about. But they may hold this money to allow them with their restart. So we put our deadlines are you start paying back at the end of the first year, and you have a 3-year payback at this interest rate and according to the terms of the loan condition. So we do not have a you must spend it by date incorporated into the guidance at this point.
Mr. Chairman, if I might add, that will also be part of how we report back to the board through the administration on, you know, if we can determine the expenditure timeframes. And then if I might, Mr. Chairman, one other thing, and we'll want clarification from the board after your discussion and any appropriate motions, but to ensure that we walk away understanding what the board's policy is on personal guarantees, and you were in the middle of talking about some of that.
Okay, Commissioner Ziegler.
I just want to provide clarification. So Janet Kahn at the Early Learning Center,
She knows these facilities inside and out, and I know she's working with the EDC on it. I mean, I had a conversation with her. It was kind of interesting. I mean, you know, they're in there constantly doing inspections and re-inspections and everything else. So she should be a good resource for the EDC as we go that route and address some of the concerns that you mentioned. So I just wanted to mention that.
Okay, I have nobody on the board. Mr. Bullock, did you have anything further?
No, sir, other than to say on the personal guarantee, I see the county attorney hovering there. We spent a lot of time trying to figure this out, and we really need to have it resolved.
Just a thought for this board. I'm happy to pass the gavel and maybe do a summary excluding a personal guarantee and maybe make the personal guarantee under a separate motion. But, actually, Commissioner Mayo, did you want?
Yeah, when we have other staff here, like the Office of the County Attorney staff, they do not need to pass notes to Mr. Lewis. Just come on up, ask us what you want to ask us, speeds it up, and gives a lot more clarity. And I love you, buddy, but you're too polite.
Did we have any, did somebody, I missed that. Does somebody want to comment from legal? Thank you, Amanda.
Hey, good morning, Commissioners. I guess, you know, it's part of a public hearing, so Carl Senku, Chief Deputy County Attorney for the record. In working with Dave and Rob and, you know, the staff at the EDC and our staff here, there are a lot of policy questions that have come up in the development
Could you just pull your mic a little?
of the loan agreement and promissory note. And that is the approach that we're taking, is to actually incorporate a lot of the requirements. The federal government, I think, only utilized a promissory note, and that's because they have an established program, established rules and regulations. Here, we're incorporating those into an agreement. And it's, I think a lot of reasonable minds can view things differently, so we just want to make sure that we have clarity on what the intent of the majority of the board is with respect to each of these elements. So on the personal guarantee, that will significantly change the scope of the agreement. So, just including another party, and we have to think about, from whom do we get those guarantees? The PPP program, I don't believe, includes any guarantees, but what it requires is that any owner with an equity stake of 20% or greater in the business entity must be disclosed. And, various communities across the country have employed these kinds of programs, and sometimes that's a metric that's utilized for the guarantee, would be somebody with 20% or greater stake.
Yeah, but can I interrupt for a minute, Carl? I
Absolutely.
want to understand that. Is if the LLC, for example, is signing the document, the LLC would be liable. What I think we're suggesting and talking about is the principals or members of these entities would be personally liable for that note.
Well, that's the policy question that I'm presenting
Okay.
is, do you want each and every principal to be personally guaranteed, or only those with a 20% stake, only one of them with a 20% or greater stake? It changes the scope and the engagement and the number of parties that we need to add to the agreement.
Fair enough. Commissioner Dieter.
The LLC, you're limited to what's in there, and it would probably be zero by the time you're defaulting, so. Are you suggesting that we're better off with a promissory note than a personal guarantee? Because you're dealing with probably a corporation-type situation, not personal.
Well, Commissioner, I think they're related yet distinct concepts. We will have a promissory note from the actual borrower, which would on occasion be an LLC,
Right.
maybe a corporate body, a partnership. There could be individuals. People still do
Right.
operate their business entities as sole proprietors. And, each of those has its own attendant requirements. So there will be a promissory note from the actual borrower. The question is whether this board requires a
Personal
guarantee above and beyond that.
Well, I am not an attorney, and I know Charles is, so he has stronger opinions, but I'm willing to leave it up to the people who work in that field.
Were you finished, Carl?
Yeah, I think, if I could just, there are a couple questions that I think that Dave posed, Mr. Bullock posed. And I know that there are so many different components here, and it would just be very helpful in a summary that we're very clear, so there's no ambiguity, because we have to, I think everyone agrees that there's some desire for some expeditious action on this. So there really won't be another opportunity for us to come back to the board to flush some of this out.
Fair enough. In the summary that I gave Mr. Bullock, did you see nothing further to add? Obviously, the personal guarantee is a topic we'll debate here, but anything further you think we should be debating?
Well, one point I would like to know is, this board set the initial interest rate, and it was something that wasn't done scientifically or discussed at a 3.5% for the loan. Presuming that that's a non-default rate, so if there is a default under the loan and the county's exposed to a greater risk, a default rate would typically be utilized. So if the board has any thoughts or feelings on what an appropriate default rate would be, it'd be helpful to know. Otherwise, I would look to the county administrator staff in the EDC to, make that decision.
Well, I'm assuming you'd have built into the promissory note and/or the personal guarantee that there'd be legal expenses and such that you'd be piling on.
Yes.
Okay. All right. I have nobody on the board right now. Any further questions for Carl? Any further questions for Mr. Bullock? I don't see any. Do you want me to pass the gavel and take a shot at this? Sure. All right, I'll pass the gavel. All right. A motion to move forward with the the, let's get this right, to move forward with the Small Business Assistance Program, including eligible expenses of insurance, marketing, and cost of goods. It would exclude nonprofits. It would only be eligible for businesses that have less than 50 employees, not equal to or less than, it's less than 50 employees. Sarasota County business tax receipts would be required for up to 3 years, at least 3 years. There'd be a personal guarantee to all shareholders or members of any type. 35 child care slots will be reserved. And I believe that's it.
Okay, we have a motion on the floor by our chair, Commissioner Moran. Is there a second? Seconded by Commissioner Ziegler. Commissioner Moran?
Yeah, I do want to take a few minutes on this, so I'll be quick. So nonprofits excluded, I think there was a very healthy conversation about that, and there's lots of logic behind why not to do it, including today's article in the newspaper. I think it was like $880,000 of money flowing for that. I understand the will of the board on that. I like a lot that we added the Sarasota County business tax receipts, because arguably that's the money that is going into that pot, is the BTR tax that's going in there. The people that paid into it should be eligible to get it back. The personal guarantee, as I mentioned, I just think it's important, is that people need to take a minute and take a breath, that if they're going to take this money, they better be ready to pay it back. And anything that would make that to the forefront, including a personal guarantee, I'd be in support of. And the 35 child care slots, I think we had a lot of discussion of that in our last meeting, and I could easily support that. But with that said, I'm completely listening. I'm just starting this motion in the interest of discussion. So, thank you.
Thank you. Commissioner Ziegler?
Yeah, is it okay if I ask Dave another question? I got another question. Is that fine, or is that inappropriate?
Sure, yeah.
Hey, Dave, let me ask you, real quick. Are you there, Dave?
Yes, I am.
Okay, so, the PPP change on this, we're still going by the PPP guidelines, though, correct?
We are, except where we add something that is county-specific.
Okay, all right, cool. Yeah, no, look, I think this program, for me, it's, we have this money just sitting in a pot, as I mentioned last time. It's there for economic development, which includes recruiting, and the second word is retaining businesses here. I think this is a retention play. This money would be just sitting there and not being used. I think it's important for us to release it. I do like the fact that we're going to get paid back on it, so it'll replenish that fund. I want to remind people there's about there was 5.2 or 5.3 million in there, if I remember, before the UF deal, and now there's like 4.4. But out of the over $5 million that's been sitting there, I think we've only paid out in the last 5 years like $350,000 or $400,000, if I remember. So, this is a pot of money there that we can, get out on the street, hopefully, save some of these businesses. I'm optimistic. Hopefully we can help more than 170 or whatever the number is. People take a little bit less. But people are struggling. And I think this county, I appreciate the commissioners coming together, providing a solution for assistance. I think it makes sense. So I'm going to be supporting this. I appreciate the changes. I appreciate our nonprofit partners and the foundations out there to assist our nonprofit partners. I think that's important. This is an opportunity for the community to rally together. These are tough times. People are getting laid off. Businesses are going under. Whatever we can do to help stop that bleed, I think, is great. And, I'm optimistic once this is over, once the coronavirus kind of gets out of the way, that we can move forward and hopefully rebound. But so I'll be supporting this. Appreciate the other commissioners' debate, discussion, and fine-tuning of it as well.
Okay, any other comments? Oh, I can't see his machine.
Commissioner Hines and Commissioner Dieter.
Commissioner Hines, then Commissioner Dieter.
All right, well, thank you, Mr. Chairman, Vice Chair. First one's a procedural thing. This is, my understanding, is a public hearing. So I think before we vote, Mr. County Attorney, we need to ask if there's any public comment on this. Is that correct?
That would be correct.
Okay, so just keep that in the back of your mind before we vote. If there is any, I don't see anybody here, but I think the record needs to be clear that we ask for that. Second of all, I really appreciate this board's attempt to help our local businesses in this tough situation. We are different than the federal government. They just add it to the national debt and move on. We're not in that situation. This is a pool of money that we've set aside to really be a big game changer, to make a difference in our community. Career creation, those types of things. My issue with this money's going to be gone in the first 15 minutes of the application process. The hurry to get it out there is going to create a lot of problems to come back to you all. I won't be on this board when it happens, but much like we saw yesterday, it's going to be more here, I believe. I hope I'm wrong, but we are picking winners and losers, and there's going to be some questions when folks get pulled and they get pulled incorrectly. The information they submitted was correct, or it was misread, and then they're denied, or you approve somebody that in their LLC has folks with significant issues with their backgrounds, their type of business that they're in. It's going to be tough, and I wish we could help more businesses take the time to do this correctly, so those types of errors that I see forthcoming are protected against. But I won't support the motion in the same reasons I've submitted 2 weeks ago. I want to help our local businesses, but I believe this fund should be protected for what it was designed to do. Thank you.
Commissioner Dieter.
Thank you. I will support it, and I am kind of compromising. I don't believe in carve-outs. I really don't like declaring, child care is more important than everything else. I don't think they're at any more risk, in fact, probably less risk of going out of business than regular businesses are, but it's a compromise, so I'm going to go ahead and leave it. I think the percentage rate that we're going to charge for continuation of the money and as it rolls into a loan, if it does roll into a loan, that could cover any defaults. So that would be money returned, and as people pay back the money, it recirculates and it will be available for other businesses in the future without this emergency plan. I think we saw a sense of outrage and hopelessness when the general public, small businesses depended on the federal government. The original PPP plan, as proposed by Senator Rubio, I thought was remarkable and great, but then the implementation and the fact that it all evaporated, small business people were keeping their people on the payroll in hopes of accessing that money. And then there was a really depression set in when they didn't get it. So for $4.3 million, we can only help 172 businesses. 35 of them would be daycares, so that's 137 other businesses. And that's not a whole heck of a lot, but those businesses that we do help will be recirculating their money within the community to start themselves back up. They will be calling vendors, ordering things, advertising, doing promotions, and so they will, as a byproduct, help other businesses in the community. So with the small pot of money that we have available, I'm glad we're able to help as many as we possibly can, and I'm happy to support the motion.
Okay, I'll just speak briefly to the motion, and then I'll ask the clerk if we have any public speaker cards. We don't. I'm going to support the motion, and I think everyone has said it. Commissioner Ziegler said it twice very eloquently. I think everybody here recognizes the great job that our nonprofits and the philanthropies do. They do so much of the heavy lifting that would likely fall to us. So I hope they understand our reasoning here. With that said, there are no one here to speak on this matter. We'll call the question. All those in favor of the motion, we are on 34A and B, and I think that Commissioner Moran's motion satisfies the intent of 34A and B. All those in favor signify by saying aye.
Aye.
Anyone opposed? The vice chair votes aye, so that's 4-1 with Commissioner Hines as a no. It's all yours, Mr.
Great,
Chairman.
thank you so much. It's absolutely an honor to serve with all you guys. We're going to have a lot of difficult topics getting through this crisis, and I'm hopeful we can treat them all like this, and that is exactly how we have good, healthy debate and everybody acting in good faith. So thank you to all. Okay, especially staff. Mr. Bullock, I don't want to do it again. I want to thank you before we close out here. I can't thank you enough. Did you need or want anything else from us?
Just 12 seconds. This is entirely the work of my staff and the private businesses that I had up on the screen. It's incredible work, and whatever success comes out of this is entirely on the part of Destin Wells and Aaron Silk and Kate Atkin and Liliana Zindler and Janet Lawson and all of the private companies. They're making this happen, and I appreciate the deep cooperation with the county staff, and we're looking to make this as successful as we possibly can. Thank you.
Great, thank you. If you could just stay on the line one more minute. It looks like legal has a quick comment for us, please.
Yeah, we still have the outstanding public purpose finding that you opened with, as well as the delegation. We didn't get any formal board action on that, so if we can address the public purpose either through consensus or motion, and the delegation will need to be made by motion.
Thank you. If I understand you correctly, Carl, at the very beginning of this, I read your finding of a public purpose. You need me to read it again? Is that what you're suggesting?
No, if we can just get some consensus or a voice vote.
If I understand what Carl's asking for from my previous discussions, is that is there anybody that objects on this board that the entire conversation we had and the reason we're doing this is for anything other than a public purpose? Seeing none, is that sufficient for you?
And so we're going to show that as a vote of the board, having declared this a public purpose? Is that what I just heard you say?
Do you need a motion on that, Carl?
I think the clarity would be helpful for the clerk.
Mr. Chairman,
Commissioner Mayo?
so moved.
Second.
I have a motion by Commissioner Mayo indicating that this entire process is for the interest of public purpose, seconded by Commissioner Dieter. Anything to the motions? Anything further from this board? All those in favor signify by saying aye. Aye. Any opposed? Chair votes aye.
Mr.
Passes
Chairman?
unanimously.
I do have a question for clarification. With respect to the recommendation, I thought I heard a 20% grant for repayment within 12 months, and I didn't hear that in the motion. Is that a part of the motion?
That was my intent. And then the second, I'm hearing, I was the motion maker, the person who made the second, that was their intent. Does anybody feel any differently to that?
That was in the presentation, so it was presumed that that was included, and that was my understanding.
Okay, we don't look at the presentation when we're doing the minutes, so I just want to
Right.
make sure we
So-
didn't misunderstand the board's intent.
No, good question.
The 20% is early payment.
Okay. Are you
Good
clear?
question.
Okay.
Is the clerk clear? Legal? Everybody okay?
Yeah, I'm good with that, and then we still have
Yes,
the.
got it. And so we got one more thing here is delegating the county administrator. So we need a motion that the county administrator is delegated the authority to approve the issuance of small business resiliency loans and to sign any documents required for the loans. Can I have a motion?
So moved.
I have a motion by Commissioner Mayo, seconded by Commissioner Dieter. Would you like to speak to the motions?
No, sir.
Seeing none, any of the county commissioners like to speak on this? Seeing none, all those in favor signify by saying aye. Anybody opposed? Chair votes aye. 4-1, Commissioner Hines saying no. I have 4-1 vote on the delegation to the county administrator.
Mr. Chairman,
Commissioner Mayo?
just a thought, I'd like to know who the guy was that suggested Carl Sanko come closer to the microphone about 15 minutes ago.
I have absolutely no idea how that's relevant, but I'll. Okay. Anything further from legal? Mr. Bullock, now I think we're done. Is anything further for you, sir?
No, sir, thank you.
Please pass along our appreciation to your staff too, sir.
I will.
All right, thank you. Okay, we're to the reports section, starting with number 35 is the clerk of the circuit court and the county comptroller.
And no report, Mr. Chairman.
Okay, county administrator? No, sir. County attorney?
Nothing to report.
Commissioner Ziegler? Nope. Commissioner Dieter? Commissioner Mayo?
Just real quickly, I had the pleasure, I think some of you also, the chief took me to our new fire station on Apex Road, and if you haven't done that, I would suggest you'd have a ball doing it, because we're getting, after some length of time, we're getting our firefighters, the men and women, fire medics.
You are muted.
Thank you.
Just
Goodbye.
absolutely art.
That's it, that's it. Hopefully I still get my paycheck.
That's the end of his
We're finally getting our
presentation.
people out of a trailer and our equipment out from under a tent. And Dave Bullock will pay for that the next time he speaks to us.
Commissioner Hines?
Yeah, just to add on a little bit what Commissioner Mayo said, you know, great job by our community staff and county staff in that there are other things that are going on besides this COVID-19. And one I want to bring out personally that we've worked so hard on is the Great Beach Nourishment Project at Minnesota Key. That moved along. It looks great. Hopefully you saw the pictures. And also I want to compliment the great job decreasing that potential $1 million in regards to that gap area down to, I think, just a little over 200,000. That's a great achievement. So congratulations to everyone involved in that. And I know the people down in Minnesota Key are very appreciative.
Okay, I'm up. I put on everybody's desk a summary, but first I wanted to thank Steve Botello and his team. He put together an amazing amount of financial information from us in a very short time frame, incredibly helpful. All as I did was literally take that information that his staff put together and put it kind of on a dashboard for us. We don't need to go through it today, but I think it'll be helpful when we get into our deep financial budget concerns related to this COVID-19. And if you could bring your attention to the column to the right, the second to the right, is all as I really did is take every year, I put a curtain down on fiscal year '07, and then took the worst year any constitutional would have, of course, us, and just put that into in an Excel spreadsheet column that shows those are the worst of the worst. So if you take a specific constitutional and their worst year was FY12, I put it in that column. But again, we don't need to go through that today. It was information that Steve and his team put together that I just kind of summarized and put it on one sheet, showing the best year of revenue coming in versus the worst year all the way back to FY07. So of course we'll be having a lot of conversation in the past. And my last thing is just a thank you to Virginia Haley. She got an incredible amount of information together for me in a short time, and I feel the need to say out loud that while it's incredibly important to me, that I'm not singling her out or Visit Sarasota at all. I just think it's a great exercise we're going to have to do for every single department, let alone our stakeholder relationships with our vendor partners. So thank you for the information. It's going to be incredibly helpful to us in some of the tough decisions we got to make. So with that, we're at agenda item number 43, which is the administration and outstanding board assignments.
No updates in addition to what you've already received.
Great. And number 44 is administration for board meeting schedule.
Yeah, the only thing I'd like to make sure the board knows, while we are going on with the May meetings, I would like the continued ability, if we have the ability to consolidate those, if the scheduling allows, that we can consolidate them like we did for the April ones. If the meetings are too full, we won't do that. But I would just like that continued ability to consolidate the Tuesday, Wednesday where possible.
Is anybody have an objection to that? Seeing none, go forward. Nothing further? Okay, we're to open to the public at the end of the meeting. Madam, no open to the public cards. Any other business for the good of the order? Seeing none, thank you all. We're adjourned.
to understand and preserve this very important piece of cultural heritage.
The ability to make and use canoes says a lot about how people got around in the world, what the speed with which they could move, how far they could go, the kind of resources they had access to. So this tells us that this maritime tradition, this way of life of taking advantage of rivers and canoes for traversing bodies of water, this has a really great antiquity in the Southeast. At least 7,000 years ago, people were building these canoes of a very similar design as they were 500 years ago. So this is a really ancient tradition. This coastal way of life is a really kind of essential part of the coastal lifeway.
What I think is exciting is this kind of opportunity where we have these different types of researchers coming together, because it's those multiple lines of evidence, you know, from the dating, the dendrochronology, and the 3D imaging. And if we're all kind of looking at things and maybe coming to the same, you know, areas that make sense, I think it's much more powerful if we have those multiple lines of indication. And what's interesting with the 3D is that it allows us to kind of forensically look at, well, okay, is that possible? What would that look like? So I think it's a nice foundation to kind of build upon, a platform to build upon all of these other scientific endeavors.
When we get a call about a dugout canoe, the first thing we do is we ask some questions. We want to know where it was found. We want to know how somebody found it, what the condition is currently, and we always tell people to leave it in place. The canoe has been safe there for hundreds, if not thousands of years. It's been preserved in an anaerobic context, and the safest place for it to be is right where it is. Only if it's threatened, and only if there's very good reason and steps put in place to conserve it, care for it, and then ultimately display it, do we remove it from that original context.
Usually it's a member of the public who calls us to let us know about the discovery of a canoe, and what we always stress is to leave it in place. We want to keep it there to safeguard it. It's been there for hundreds, if not thousands of years, and it's usually the best place for it. When we investigate it, we'll get measurements from it and note its typology, and if we feel like it is needed to be moved for conservation purposes, we'll bring it to the conservation lab here in Tallahassee.
The first thing that's really changed in canoe research and canoe conservation and preservation is awareness. And in the 1980s, the University of Florida did a large project to try to gather information about dugout canoes. And through putting ads in newspapers and contacting people and getting information, they really put the word out there that if you find a canoe, the best thing to do is report it. So that's the number one thing that's changed. And in terms of preservation, some techniques have come about that now are doing a much better job of preserving canoes than, say, some of the early techniques like soaking in sugar water. We're not really doing that anymore, but people made do with the best they had at the time. And that at the time, perhaps turpentine and linseed oil were the methods of the day, and now we would rather treat it in a lab under conditions that can, one, be reversed, and two, are going to be more stable over time.
Well, there are a few different things that are done, but the one that I'm most familiar with is polyethylene glycol used as a consolidant, because over time often the cellulose structure of a canoe has been degraded, especially if it's been wet, and polyethylene glycol acts as a wax that fortifies the internal structure.
Unfortunately, we did lose some data due to methods that weren't ideal in the early days. An example of that is a canoe that's now fragmented into a lot of pieces. It was preserved with the sugar method, quote unquote, and it's now a very greasy and probably sweet if you were to taste it. Small fragmented pieces of wood, and that's from one of our oldest canoe sites, De Leon Springs.
The best known site for canoes in Florida is the Noonan's Lake site east of Gainesville. There was a period in the early 2000s of really extreme drought, really low water levels in the lake, and people who lived in the area just started finding all these canoes one after another, and they eventually, over the course of several months, excavated something like 100 canoes, and they radiocarbon dated, I think, 55 of those, and those spanned everywhere from 500 years old to 6,000 years old, so it really had the whole spectrum up until historic times nearly.
Honestly, they're all exciting on the scale of all of the dugouts from Florida. So each individual piece of data is important to add to our database, and there's never a time when we say that's not important enough to record. We always record them.
When most people think of canoe archaeology, probably the first thing to come to mind is the thrill of discovery and the subsequent fieldwork. But the reality is that most archaeology is done in laboratories like this Bureau of Archaeological Research Conservation Lab in Tallahassee.
That's right. A lot of the work that we do is done indoors studying the material. So for every 1 day in the field, give or take, we have to spend 5 or 6 times that amount of time working in the lab, in the museum, working in our offices, analyzing the data. And this is particularly important because what we do is essentially a kind of destructive science. You can't re-excavate something that's already been excavated. So as you're taking something out of the ground, you've got to be very careful about how you document the information, and also you have to make sure you make that information available, both in the scientific reports and also out to the public. Because what you're doing when you're excavating is you're removing things from the ground, and that can never be reconstructed again. So this is why we spend so much time outside of the field and in the office preparing reports, trying to put together museum exhibits, all of these things so that once we've excavated our site, we can share it with the world.
In the radiocarbon dating lab, we pretty much get everybody's most precious, most important finds from sites all over the world. So in the field, you see a lot of really cool stuff from one site. But in our lab, we see the most important or most precious things that primary or principal investigator thought was a really crucial piece of evidence for understanding the story of their site. So we get to see all of this come through every day. Every day is different. We always see different things, different really cool things from all over the world. So we kind of look at things more on the molecular level, whereas the field archaeologists are looking at things on the site level. So it's a difference of scale, really.
Radiocarbon dating was developed in 1949 by Willard Libby and quickly became a primary tool for archaeologists to determine the age of objects.
So there's 3 different kinds of carbon that's naturally occurring. C14 is the only one that's radioactive, which means it is made from nitrogen, a reaction between nitrogen and neutrons from the sun, and its destiny is to decay back to nitrogen again. So carbon cycles through the biosphere, through the food web. Once you die, we all die. Eventually, when we die, we stop replenishing that C14 in our bodies, and the C14 continues to decay to nitrogen. So over time, the amount of C14 in your body declines at a rate that's well known and has been well calculated. So if we know how much C14 was in your body when you died, and we can measure how much C14 is in your body after death, we can calculate how long it's been since the organism died.
Since the late 1940s, the methods used for radiocarbon dating have improved.
The biggest change is what actually is being counted. So in the early days of radiocarbon dating, we needed really large samples because we weren't actually counting C14 atoms directly. Instead, we were counting the decay events. We were counting that energy that came off the decay from C14 as it was turning back into N14. So now we're able, through accelerator mass spectrometry, to actually count directly the number of C14 atoms rather than waiting to count those decay events. So instead of using large samples, sometimes up to a kilogram of carbon, we can measure samples as small as 1 milligram of pure carbon. So our precision is better, the sample sizes required are much smaller, and it's actually extended the upper limit of radiocarbon dating a little bit as well.
Radiocarbon dating is used by archaeologists to determine the age of canoes discovered in Florida.
Well, there have been a couple hundred canoes at least that I know of that have been radiocarbon dated in Florida, and wood is a perfect material for radiocarbon dating because it's organic, it has a lot of carbon in it, and we can measure the C14 content of these canoes to get an estimate of how old the wood was, how old is the material that the canoes are made out of. So using radiocarbon dating, we've dated, I think the oldest date that I know of for a canoe in Florida is about 7,000 years old. So this is the first one that's been dated, the oldest one that's been dated. It's possible that there are older canoes that just haven't been discovered yet.
The ancient Greeks observed that rings form inside tree trunks, and in the Renaissance, Leonardo da Vinci noticed that those tree rings form annually. By the early 20th century, dendrochronology evolved as a science.
It evolved with Andrew Ellicott Douglas in the 1920s. It's pretty well known that trees produce annual rings. Trees in temperate environments produce annual rings. But as dendrochronologists, what we're looking at is the variability in ring width. So trees in their environment, they're sessile, they can't move around. So they're actually kind of integrating into their physical bodies the environmental variability that they're exposed to. So during a drought year, trees in that region will produce a narrow ring. So yeah, that variability in ring width is what allows us to do dendrochronology.
The study of tree rings evolved to help scientists determine more than just the age of wooden objects like canoes.
It started as an archaeological science. So Andrew Ellicott Douglas, his first publication in 1929 in the National Geographic, was about dating the Pueblos in the American Southwest. So it really does have its roots in archaeology, so to speak. But it's evolved to encompass all kinds of other fields. So there's dendroclimatology, there's dendroecology. So using that variability in ring width and other aspects of the tree ring itself, we can explore different aspects of the environment.
Along with radiocarbon dating, dendrochronology helps archaeologists determine when Florida's dugout canoes were created. Cross-dating is the first principle of dendrochronology.
There's going to be the pattern of variability in ring widths. So if we have an item, an archaeological piece, say a canoe that is undated, we call that a floating chronology.